Buenos días. Si vamos sentando.
Good morning. Please take your seats. Thank you.
Good morning, everyone, and welcome to this international organized in the framework of the European Commission-funded project on the reform of social inclusion pathways in Spain. The workshop will be conducted in English, but I'm going to say a few words in Spanish just as an introduction. Si alguno necesitáis
If anyone should need interpreting, here on the right we have headsets and staff to distribute them. Most of the event will be held in English, but it will be translated toward Spanish and toward English. I think we will have no problems. Please feel free to participate in any language you feel most comfortable in.
That you have made time to join us today for this workshop. We are joined by quite a lot of people. In fact, we have representatives from different Spanish ministries, from the autonomous communities, from local entities, from third sector entities, and also from MINET delegates of the MINET network event that will be taking place tomorrow. So thank you all for being here. We are very grateful that you have joined us today. This workshop provides a key opportunity for us, and in the context of this project, for gathering best practices in the area of social inclusion, and especially practices that can be of special relevance for the context of Spain. And we are really looking forward to learning from the experts that we have invited, but also to get to know your views as practitioners on how do you think the practices that will be presented today fit into the frameworks that you are working on. So with this, I would just like to start formally the event by inviting Maria Canal Foncuberta, who is European Semester Officer of the European Commission at the Permanent Representation of the European Commission in Madrid, to open the event. Thank you, Maria.
Hola, muy buenos.
Hello, good morning to all. Welcome.
In the name of the European Commission, welcome to your house, your home. This is the Europe Room, so feel entirely at home. It is a pleasure to be here today for the European Conference on Social Inclusion after such a long time of no face-to-face contacts. It is really good to be able to talk to each other, to see each other again, and to exchange in person. As you all know well, the firm commitment towards more fairness has been at the very core of the mandate of this Commission. It was at the heart of many of the decisions that were taken to mitigate the economic consequences of the COVID pandemic, and it is also at the heart of many of the decisions that are being taken to palliate the consequences of the Russian war against the Ukraine in Europe. Our roadmap to fight for more inclusion, more social cohesion, is the implementation of the European Pillar of Social Rights. It is crucial to achieve more social convergence in Europe. The Commission's action plan on this implementation proposes new targets on employment, skills, and social inclusion you know well. Right now, we have more than 95 million people in Europe that live at the risk of poverty or social exclusion. We have committed to bring down in 15 million this number from now to 2030. And amongst those 15 million that we want to live out of poverty and social exclusion, we would like to see at least 5 million children. Steps are being taken in this direction with, for instance, the recent proposal for a Council recommendation on minimum income schemes, and I know that many of you have been very much behind this proposal, so you know it well. With the very recent as well communication from the Commission on the evaluation of the distributional impact of national policies, with the European Care Strategy adopted in September, with the directive on minimum wages to lift people out of poverty when they are working, that is going to be implemented by all member states soon, and with the implementation of the child guarantee scheme that is starting in all member states. The firm commitment of this Commission not to leave anyone behind is fully embedded in our cycle of macroeconomic policies, the semester, where the social scoreboard allows the Commission to monitor progress with each of the indicators. It is also fully embedded in the EU budget, where apart from the MFF, we have the Recovery and Resilience Facility, the huge solidarity effort that was agreed to lift us out of the pandemic and to transform our societies for the future, the digital, the green transformation, but also more inclusive societies. The RRF devotes at least 13.9 billion euros in all the approved recovery and resilience national plans to social protection. If we include in those figures those devoted to social housing, we reach 28.4 billion euros. With all this in mind, I think we have to move on. I know you have a lot to exchange, a lot to learn from each other, also together with the OECD. So I will now give the floor to the next panel, to Herwig Immervoll, Milagros Paniagua, and Raluca Painter, who's going to join us online. And I wish you very fruitful discussions. Thank you.
Thank you very much, Maria, for this reflection. And I would like now to invite Raluca Painter, who is Head of Unit B4 of the European Commission, Directorate General for Structural Reform Support. Unfortunately, she was not able to join us in Madrid today, so she's here. Oh, okay, so maybe we can switch a bit the order, and Herwig, do you feel like going ahead? Then I would like to invite Herwig Immervoll, Head of Employment-Oriented Social Policy at the OECD, who will highlight a number of key findings from the OECD work on social inclusion, drawing on OECD's expertise in its prior work with national governments in this area. Herwig, the floor is yours.
Well, thank you very much. It's good to be here in Madrid. My name is Herwig Immervoll, and I have the happy task to welcome you here to this event on behalf of the OECD. I have to say, I have not seen at the OECD a room that is this nicely filled, and to see so many people engaged already in conversation, not on the screen, but in real person. So this is very exciting, and glad many of you could make it. And we look forward to discussing together with you So we really emphasize the interactive aspect of today's event, the challenges and best practices in the area of social inclusion. The insights and exchanges today will directly feed into the ongoing work that was already mentioned to support Spain's reform efforts in this area. And I hope and I trust that they will be of interest to all of you. The workshop and the wider project on social inclusion pathways in Spain are organized in cooperation with the European Commission's DG Reform and with the Ministry of Inclusion, Social Security and Migration. And I would like to thank both institutions for their trust and for their excellent cooperation as part of this project. In particular, Secretary General Milagros Paniagua and Raluca Painter from DG Reform. So good morning to both of you. I would like to also thank speakers from EU and OECD countries for agreeing to present actually a wide range of fascinating policy examples, and we will devote significant time later this morning and afternoon to hear about them. We're also very fortunate to be able to organize today's workshop back-to-back with tomorrow's meeting of the Minimum Income Network, and many colleagues from the network are either in the room or connected. So this is an opportunity to exchange with experts across EU member states, and this is really welcome. Now, with these and related projects on social policy, our role at the OECD is to put expertise and evidence at the service of our member countries. So just last week, OECD colleagues and some of you actually were also here in Madrid to present results of a close cooperation to modernize social services in Spain. This activity also took place in the context of a DG Reform project, together with the Ministry of Social Rights and the 2030 agenda. The project undertook a comprehensive stock-taking on the provisions of social services in the 17 autonomous communities and 2 autonomous cities. And I think this was maybe the first or one of the few comprehensive comparative assessments within Spain, and the project also formulated recommendations. Social inclusion in particular, so if we zoom from social policies more broadly to social inclusion in particular, is a long-standing focus of the OECD's work program. The 2018 publication, which had the fitting title, A Broken Social Elevator, emphasized that too many with low incomes, or in fact low-earning parents, are in fact trapped at the bottom of the social ladder. And closely related to what we are discussing here today, the report highlighted the multinational nature of inequality and the need to strengthen equality of opportunity using actually multiple policy levers, including education, health and family policies, employment, taxes and transfers, and also housing. So the challenges are formidable. The OECD also has a tradition, and in some ways perhaps best known, for providing comparative information on social protection policies and their outcomes. This includes indicators on the receipt and the adequacy of minimum income programs, and some of these OECD indicators are also feed into the EU's own benchmarking of minimum income support. The indicators provide a useful comparative perspective of policy configurations and also policy challenges. Now, of course, by themselves, indicators do not give answers on how challenges can and should be addressed. For that, it is key to have a close look at policy institutions and programs, and also at the circumstances of the people that they serve. And this will indeed be our objectives for today. So before we get started, just a few words about the topic and today's event and discussions. Adequate social inclusion mechanisms are, of course, key policy priorities across OECD and EU countries. Indeed, social exclusion and entrenched inequalities have been major concerns well before the pandemic, but the consequences of COVID-19 and the current cost of living crisis have made the need for timely and accessible support ever more pressing, and often achieving this requires careful reform. In Spain, the need for reform is reflected in the government's commitment to strengthening minimum income benefits. Linked to that is an objective to put in place a comprehensive framework for one might call social inclusion pathways. And let me briefly sketch the policy context in Spain that many of you know extremely well. In 2020, Spain began rolling out the Ingreso Mínimo Vital, which is essentially an income floor that applies and is common across the country. This was a big step forward and towards social minimum income standards that are more equal across Spain. Indeed, having a unified system of cash support is not universal across EU and OECD countries, and it entails a significant transformation of social inclusion policies towards a more coordinated model, if you like. Connected to this reform of cash support, but going beyond income transfers, is an objective to build a coordinated set of broader support programs that work in combination and across policy domains to tackle social disadvantage and support the inclusion of the most disadvantaged. In other words, inclusion pathways. In this context, the focus of today's workshop will be on two specific aspects that have come up centrally as part of this project and that critically determine whether inclusion measures are effective and whether they are accessible. First, in the morning, we devote our time to the topic of integrating different inclusion services. In a context where the intended beneficiaries of support programs face a range of different and complex barriers, country experiences demonstrate that integrated service delivery can not only benefit users and improve service quality, but they can also make public provision of support more efficient and cost-effective. For instance, already in 2015, an OECD report entitled Integrating Social Services for Vulnerable Groups illustrated countries' approaches and their payoffs. But it also highlighted, and that's important for our discussions today, major institutional, administrative, and often practical obstacles to successful integration. Today's morning session will focus on integration challenges and solutions for vulnerable groups, in particular for those who are in some sense at the margins of society, those who are excluded or at risk of exclusion, with examples from Germany, from Italy, Spain, and the United Kingdom. In the afternoon, we will focus on strengthening the take-up of support programs. Incomplete take-up is a phenomenon that is not always easy to measure, but it is sizable, especially for means-tested support and needs-targeted support. Non-take-up undermines program effectiveness by limiting its overall reach, including for groups who are in the greatest need of support. Patterns of non-take-up are of specific interest for newly established and expanding programs, such as the Ingreso Mínimo Vital, that explicitly aim to provide better and more equitable access to support. Now, tackling non-take-up requires understanding the specific reasons why people do not or cannot make use of available support. So going beyond simply quantifying the problem, what can we do about it? The factors are often interrelated, and they include stigma, a lack of information, complex program rules or administration, as well as low benefit values or administrative errors. And this afternoon session will discuss how these problems can be addressed with specific examples of two specific approaches: active outreach and automatic enrollment. So let me stop here and thank you once again for joining us today. With your active participation and the evidence emerging from the wider project, we hope that Spain, and actually all of us, will be able to draw valuable lessons for strengthening social inclusion. Thank you very much.
Thank you, Herwig. And now, yes, we have Raluca Painter, Head of Unit Before of DG Reform, who will join us virtually to give also some introductory remarks.
It works? Can you hear me? Okay, perfect. First of all, I'd like to thank very much the Ministry of Inclusion, Social Security and Migration for organizing today's event and inviting me to speak. Unfortunately, I couldn't be there with you in Madrid, but nevertheless, I'm very happy to deliver some remarks to tell you about the work of DG Reform, but also the broader Commission priorities on inclusion. Today's workshop is very, I would say, timely and important because it focuses on best practices for the design of social inclusion policies. And in the general overall context that I will mention in a moment, these are very relevant topics that deserve a lot of attention, effort, and focus at member state level, at the EU level, and then at the level of the different actors in the member states. I would also like to thank the implementing partner we have on this project, the OECD team, for organizing the sessions that we will be attending and for liaising with the different participants that are in the room today. Now, a few words on inclusion and the broader work of the Commission. Since the COVID pandemic, where the ones, let's say, most vulnerable have been also the ones more impacted across the member states, the Commission has put in place a number of initiatives, whether strategies or proposals for Council acts in order, first of all, to bring to the attention the need to focus and to address social exclusion, to prevent disruption, but also to find ways to support member states at national, but also regional and local level. So immediately after the breakout of the pandemic, the focus was on the integration and inclusion of people that are vulnerable, including migrants, asylum seekers, or people with disabilities or ethnic minorities. This action plan, which has been adopted in 2020, focuses on policies that could be adopted in the area of education and training, activation policies for the labor market, skills recognition and accreditation procedures, which are key for the integration of migrants into the labor market, but also access to housing and to health. Then another focus that followed at the EU level was on the persons with disabilities. Why? Because they are typically a category of individuals that face difficulties in accessing the labor market, but also a number of other services. And the strategy adopted recommended to put more effort into increasing the participation of the people with disabilities, not only into the labor market, but also in accessing education and also in providing a more favorable framework for intra-EU mobility of these persons. Then a key moment was May 2021, the Porto Summit, where at the highest level, the leaders of the EU have made a number of commitments. And then on the Commission side, there has been an action plan in order to implement more rapidly the principles set in the European Pillar of Social Rights. The European Pillar of Social Rights is a document that dates from 2017, but which comprises a number of principles that aim at increasing access to education, to the labor market, social services, and healthcare for Europeans, but again, with a big focus on the most vulnerable people. And that action plan sets some very ambitious targets in terms of employment. So by 2030, the idea is to reach at the EU level an employment rate of 78%, So as I said, very ambitious, but also it sets a target of having more people in annual training, reaching 60%, which again is very ambitious considering that in some member states the participation into annual training is rather low. And then the third important target refers to lifting people out of poverty with the overall objective of lifting 15 million Europeans out of poverty, including children. And then this key act was followed by more focused recommendations on active labor market policies, but also, very importantly, a proposal for a recommendation on minimum income. The purpose of this recommendation is precisely to help member states to reduce poverty and promote reintegration into the labor market. It also places a strong emphasis on the need to ensure activation policies, providing incentives for people to go back to the labor market, which was very important also against the background of the COVID pandemic and the impact it had on businesses and therefore ultimately on the jobs that people have. So all these pieces of legislation or strategies adopted by the Commission were really in order to channel and to have a more concerted approach in order to focus on all these inclusions aspect that I mentioned. Now, on the DG reform side, we are there to support member states whenever they wish to get advice, technical expertise on how to undertake reforms. And reforms targeted towards labor markets, increasing the employment rate, inclusion of people with disabilities or inclusion of migrants are areas in which we have engaged with a number of member states. And what we're really proud of in DG Reform, I would say, is the fact that every time we work with a member state, like it is the case of Spain on this specific project, we do focus on the national priorities, challenges, and then with the help of the organization that provides support, so the OECD, the advice, the expertise is really tailored to the needs, taking into account the national realities. Of course, events like today are to bring good practices from other corners of the EU. We believe it's very important to exchange with others, to see the challenges that were faced elsewhere, because discussing, hearing others is a way to inform the reflection, to inform the policy direction, and maybe find solutions that could be implemented nationally or at the local level. So we have, for example, I will give you some illustrations of the type of other support we provide in other member states to give you an idea of the concerns and reform projects that other member states have. So we have worked with Greece, for example, with the Social Security Authority in order to assist them to roll out guaranteed minimum income scheme at national level. So there, the decision was already made, but the project really focused on the implementation. So we helped them to select a number of parameters, eligibility criteria for the implementation of the guaranteed minimum income scheme. And then we provided recommendations to ensure the sustainability of the reform from the point of view of budgetary, institutional, and operational aspects. Then with Romania, for example, we had a project where the focus was on Roma and how they could be better integrated into the labor market. And there, the idea was to really build on the existing framework a number of actions and a number of indicators and methodology in order to enable the authorities to have, first of all, a better idea of the number of people that needed support, and then have instruments and methodology to help them with the integration, and then to monitor the situation. Maybe a last example from other countries. We have also worked with the Estonian Ministry of Social Affairs, and there the objective was to support them to move towards a more integrated and person-centered provision of social, medical, and vocational support services for people with disabilities and elderly people that have high support needs. And there, the project led to providing tailored recommendations for a new strategy that the Estonian government then set in order to improve the interoperability of registries that they have already in place. So in order to better use the data and improve the collection of data, we also help them to develop new measures and indicators to support quality improvement and assess performance. And very important as well, helping them to better coordinate the different services at national level, with the focus on coordination between the national and local level. So all this to say that inclusion policies are one important area on which we're working in DG Reform. Now in Spain, the provision of inclusion policies is mostly decentralized, and the responsibility over the provision of services geared towards the labor market and social integration of specific vulnerable groups, and that lies with the autonomous regions. And we salute the vote of the Spanish Parliament in May 2020 of the minimum income scheme, because that is a way in order to support people that are, let's say, in a more vulnerable situation. And this is why we are very happy to support the Ministry of Inclusion, Social Security and Migration on this project that aims at providing recommendations on how to develop new inclusion itineraries for recipients of the minimum income scheme and other vulnerable groups. So we, together with Elisa, my colleague, who is actually in the lead on the reform side for this project, we are happy to see that already when we were contacted by the ministry, the idea, the reform project was quite mature. We saw a lot of commitment, and this is really great because, as I said upon my introductory remarks, commitment is needed because these issues are not easy to address, but through constant effort and coordination, we do believe that we can arrive at tangible results for the people that need support. Then, of course, we are happy to see that we have a great team of experts on which we're working, so on the OECD side. And I will close it by saying that today's event is something that we try to organize on each and every project. So bringing together experiences from other places, facilitating exchanges in order to identify the best possible measures for the beneficiary authorities. So thank you very much again, and I wish us all very interesting discussions today.
Thank you very much, Raluca, for these very interesting introductory remarks. And so lastly, I would like to invite Milagros Paniagua, General Secretary for Inclusion at the Spanish Ministry of Inclusion, Social Security and Migration, to provide a few words on the significance of this project for Spain. The floor is yours.
Thank you very much. Good morning, everyone. And I'd like to start saying thank you to the European Commission and their delegates, their representatives in Spain, for hosting us today here in their offices. Thank you very much. And I would like to wish you a very warm welcome to Spain, very warm welcome to this conference on social inclusion, to the OECD members, to the MENET groups, to the representatives from all the European members. We're very happy to have you here. And face-to-face, as they said when presenting this event, because we've been using this video conference so many times, that it's so kind having you around that I'm sure we will celebrating very happily this conference. So let me give you a very warm welcome. First of all, before pointing about what this event is about, I'd like to give you some insights about what the social inclusion policy has been so far for Spain. Because at the beginning of 2020, the inclusion policy didn't exist. So we've been running a policy for a bit more than a couple of years. And what we have now is that in June 2020, we launched the minimum income scheme. And today, a bit more than 2 years since that, what we have is a bit more than 500,000 households covered by the minimum income scheme, 1.4 million people beneficiaries of the minimum income scheme. And the design that we performed at the beginning was quite focused on women and children. And that has a consequence, because now, within these figures, what we see is that we have about 600,000 children, that 2 out of 3 households are headed by women, and that 1 out of 4 households are lone parent households, also headed by women. So the minimum income scheme was quite targeted because of that, because we knew the need before designing the minimum income scheme. Within these figures, I have to add up something which has been said in the presentation, which is linked to the coverage to children, because the minimum income scheme designed an extra child benefit for children, and now we are near 300,000 households covered by this child benefit linked to the minimum income scheme. So here you are the figures. There's lots of things to say about these figures, but I just wanted to give you the idea that this didn't exist a bit more than 2 years ago, and now we have these figures on the table. There's lots to say about that, but and we keep on working. This is expected to raise, to increase. But there are more things linked to the minimum income scheme, to the benefit itself. It's a non-contributory means-tested benefit of the Social Security. But now, linked to the minimum income scheme, there's another part of the benefit, which is, let's say, an in-work benefit or an incentive to work linked to the minimum income scheme. And that means that since the minimum income scheme, I think you'll be able to discuss this within this conference, but the minimum income scheme in Spain is a benefit which is calculated as follows. First of all, depending on the sort of household you live on, you have a guaranteed income, and then we check what your income from work and other source of income you have, and the minimum income scheme is the difference between the guaranteed income and the existing income. That means that it's compatible with the salaries, because we wanted to avoid the poverty trap and make people be able to be receiving the minimum income scheme at the same time that they were working. But what we want is to make it attractive in the sense that if you get an extra euro from work, you don't lose the whole euro from the minimum income scheme, but you will be losing less because of this incentive to work. So that's related to the benefit itself, but in the law, at the beginning, we defined the inclusion policy twofold. On the one hand, it was income coverage, but at the same time, we wanted to deploy all these itineraries of inclusion to help people for the transition to a better situation, to inclusion policies. In this respect, we've run already a project funded by the European Commission, by the Next Gen mechanism, a project with 34 project itineraries in the whole country. These have been done with the autonomous communities, with the municipalities, and with the NGOs. And these itineraries are then to learn. So we are meant to have some findings at the beginning of 2024. And I'm sure this conference will be very useful to have all these findings at the beginning of 2024, because we'll be able to exchange lots of experiences that from all the member states will be shared. And there's another issue. We've been working hard during this period, which is the non-take up. Because when we designed the minimum income scheme, we had some expectations, some estimates provided by let's say, the best administrative data that we could have related to income and wealth for all the households in Spain. But our expectations were not fulfilled, as it happens in all means-tested benefits, and it happens in all the member states. So we've been working hard, trying to reduce and actively looking up for people who didn't apply for the benefit and apparently being able to fulfill the requirements of the benefit. So we'll have the chance to talk about all the actions that we've taken to reduce this non-take-up. And one of the actions that we've just run last week is the minimum income scheme bus, which is a bus that will travel around Spain to help people apply for the minimum income scheme, give some information. So this way, we'll try to reduce as much as possible this non-take-up that we know that is an issue for Spain and all the member states. So given you this framework, I have to say how important this conference is for us, for the Ministry of Inclusion. Today's sessions with the OECD will be very interesting in relationship with the service integration and also non-take-up in the afternoon. And tomorrow with the mini group, we'll have a very good moment to discuss about what the mini group has been so far, helping and supporting the European Commission to have the work needed for this European Commission recommendation, but at the same time for something which all the member states we have been using so far, which is the mutual learning and all this exchange of knowledge between member states. We'll have the opportunity, the mini group members, to discuss to what extent this group has more to say, and I'm sure that it will be a very fruitful discussion. So let me finally tell you how glad and happy I am to have you all here, and I'm sure this conference will be a great conference, and enjoy your time in Madrid. Thank you.
Thank you very much, Milagros, for these important insights, and thank you to all of our speakers. I think that the words that you have just said are really good for setting the scene, and we have gained some very valuable insights for the topics that we will be discussing today, both in terms of service integration and the need for it, and also on the need for having better policies to tackling incomplete take-up. So thank you very much for these remarks, and with this we will move to the next session.
Buenos días a todas y a todos. Si os parece...
Ladies and gentlemen, let's tackle the second point in the agenda. The OECD representatives that are with us today will delve into the project, the coordination mechanisms and tools for the integration of social inclusion services in Spain with the conclusions. Most up-to-date conclusions. We'll be talking about the project. So before we give the floor, I would just like to thank the regions and local governments, cities, third sectors, and other entities that have participated, completed the surveys sent by the OECD, and participated in the interviews done by the OECD teams. Because we know that your time is limited and it has represented an effort. For us, though, it is of utmost importance because thanks to that, we will get the necessary info so that the project can really be useful. I would also like to point out the excellent syntony and coordination that exists between the institutions participating in the project, the European Commission as a financing entity, OECD as the running entity, and the ministry itself as the one that has proposed this project and final coordinator. This is absolutely needed so that the project can offer the expected results. Without further ado, I am giving the floor to Ariane and Herwig. Thank you very much.
Thank you very much. Muchas gracias, Esther, y me aprovecho.
Thank you so much, Esther. I'm taking this occasion to also thank here, I see loads of familiar faces, so all the people that have filled all of the surveys. I know that I have asked for a lot of your time, so thank you so much.
Start with the presentation. Just let me do a very tiny thing here. Because I wasn't seeing the actual slide. So we are going to give a presentation that we will try to keep short on the project that is bringing us here today, which is a very comprehensive project actually on innovative methodologies for the design and evaluation of inclusion policies. So as I think you're aware by now, it's a project funded by the European Commission that the OECD is doing in collaboration with the Spanish Ministry for Inclusion, Social Security and Migration. We have been working on this project for about a year now, and there's still 1 year ahead of work. So the main goal of this project is to support Spain in efforts to meet, sorry, I really need to change the, okay. No, like this is fine, but thing is like I couldn't see it. Yes.
You can just turn to the...
Yes, probably. So just to support Spain, okay, thanks. In efforts to meet inclusion objectives that are jointly established by all relevant levels of government, which is one of the reasons why we have been so much in touch with the autonomous communities and local entities. We also have some more specific objectives, including really a mapping and establishment of which are the barriers and the needs that the people at risk of exclusion are facing. Oops, I broke the system. Perdón. But now I see it better, so it's a win-win. Okay, but I think they will do their magic over there.
There's the magic.
Let's try. Vale. Ya. Vale. Perfecto. No toco. Le puedo dar a agrandar esto, ¿verdad? Sí. Entonces. Okay, so let's try to restart this. Let's try, even if I don't see very well what I'm telling you. So I was telling you about our specific project, specific objectives. One of them is really getting to know which barriers and needs are faced by the population at risk of social exclusion. So we are working in a very multidisciplinary team within the OECD to really get data-wise what is happening to people at social exclusion and the extent to which they are facing different barriers. Another of our specific objectives is to map and assess the suitability of current inclusion models in place in the autonomous communities. And with all of this, together with the best practices that we are gathering throughout our analysis and in events such as today, we aim to propose a new inclusion model for Spain to develop in the future in collaboration with the Spanish ministry. Is it? Wait. Wait, this is not. Okay, so we are doing this through. Okay, I have a problem, which is that I don't see it here. No me sale aquí lo que me sale aquí, entonces. ¿Sí? Vale.
Para atrás en vez de para adelante.
Vale.
Adelante es aquí.
Igual es mejor que me sienta aquí y lo haga desde aquí, porque aquí sí que lo veo. Y aquí no se me está moviendo. No he tocado nada, solo he tocado esto.
You see it here? Why don't you
Yeah,
just
yeah,
sit?
that's what I'm suggesting to him. Pero, o sea, me siento aquí, igual es lo más rápido, ¿no?
No, es que si no vamos a tener la sensación.
Como se ve aquí, ¿por qué no me siento aquí y presento desde aquí?
Sí, vale, pero se ha quedado esto muy claro.
Vale, y a ver si hago así,
Abajo es para adelante.
para abajo es para adelante. Okay, this was not planned. But I think now we are both seeing the same thing, and I know how to use the stick, so not bad. So I was telling you we have 3 objectives, and this is being operationalized through 5 main outputs. We are going to focus today on the first 2 outputs of this project that we have already been working on for a year and that we have preliminary results of. The first one is a typology of how social inclusion works in the different autonomous community. The second one is a mapping of inclusion barriers and support itineraries for the target groups of minimum income schemes and, of course, the Ingreso Mínimo Vital. Then we have output 3, which is what has brought us here, which is our attempt to gather a series of best practices that are relevant for the context of social inclusion in Spain. This will consist on this workshop where we want to hear your expertise, both from the experts, from the audience, on how you see these best practices fitting into the Spanish context. And once we will have all of these 3 outputs, we are actually now starting working on output 4, which will be the proposal for new inclusion models that take into account all the previous analysis and assessment, and that will, of course, be done in collaboration with the Ministry of Inclusion and with all relevant stakeholders. So you will hear even more about us for that. And finally, once we have this proposal, we will develop a roadmap for the pilot implementation of these specific inclusion models. So here you can see a timeline. We are more or less over that gray dot line over there. As you can see, output 1, which I will present in a minute, is almost done. We are finalizing the final draft. Output 2, we have been also working on for a long time. There's still a bit to go, but Herwig will tell you a bit more about that in a minute. Then output 3, we have been working on it for a short while now, and our idea is to take this workshop as really the turning point where we have a clear idea of best practices that we can propose of how they can fit into the Spanish context, and that will all be put together into a report that we hope to have by December this year. And then starting from all of this evidence that we have now, we will develop the proposals for new inclusion models, let's say, during the first half of 2023, and then we will start with the pilot implementation by the end of next year. So those are the plans. And now let me tell you about the work that has already been done, which is output 1. This has been a very extensive report on the typology of organization of inclusion pathways in Spain. And as I was saying before, a lot of you probably know me already because I have been asking 1,000 questions via email, interviewing you, sending these very long questionnaires that I am very grateful for all of your time. So let me start with what we have found. So our preliminary conclusions, which are basically 5 key challenges for social inclusion. So the 5 key challenges that we have found in the Spanish context include the need for a transition towards a broader and more multidimensional understanding of social inclusion policies across policy areas. And I will touch on that a bit more in a minute. How do we want to achieve this multidimensional understanding? Probably through formal coordination mechanisms. There is a need in Spain for going a bit more formal when it comes to coordination, the creation of specific bodies, coordination protocols, and so on. We also have found that the adequacy of resources can be a challenge in some autonomous communities, and in particular when it comes to really having a good fit between the level of resources that are allocated and the changing needs of the population. We have seen the pandemic recently. We are living through the cost of living crisis. So we also need to take into account that needs change and that policies need to adapt to these constant changes of policy clients. Our 4th challenge would entail moving towards an evaluation framework that ensures continuity and social inclusion frameworks that have a mid-long-term perspective in time and are not just restricted to a few years. And our last challenge, of course, in this digitalization era, refers to the adaptation to digital challenges, and this applies both to the administration and to providing adequate policy support for those who do not have the necessary digital skills. So, starting with the need for a more multidimensional approach to inclusion. What we find at the moment in Spain is that we have 6 autonomous communities that have updated social inclusion plans. This number can be raised up to 9 if we take into account those that ended no earlier than in 2020, and we are well aware that some of the plans and the strategies ending in 2020, 2021, and 2022 have seen some extensions due to the pandemic. Some of them were frozen and then are still being implemented, but still this leaves us with from 8 to 11 autonomous communities that have not developed a really comprehensive social inclusion framework. What this translates into in the reality is that in most autonomous communities, the social services department is the main and sometimes the only actor in charge of social inclusion. But we also know that people who face social inclusion challenges face a very multidimensional array of challenges that include health, housing, care policies, labor market, education, training, and so on. So having a clear social inclusion framework in a strategy can really help the interaction of the different government departments to get this multidimensional approach. And what we have seen is that there have been some recent efforts, and especially in the area of employment and social services, to integrate areas, but this has not been moved forward to other areas such as health or housing that are way less integrated with social services at the moment in Spain. So how do we become more multidimensional? what we have identified is that formal coordination mechanisms, and by this I mean interdepartmental bodies and coordination protocols and data sharing mechanisms as well, all of these can enhance within government communication. And in fact, having a stronger involvement of local entities and also third sector entities is also something that can really improve this multidimensional conception, because it allows to translate the changing needs of people on the ground to the more regional levels of the administration and really to adapt policies to the changing needs. And something that we have also found in terms of coordination is that there is a strong need for this at the local level. So we know that coordination takes place at the local level, and I think that we have some representatives from local entities here, but we also know that this happens a lot of times informally, through the goodwill of professionals who happen to know each other and collaborate just out of their goodwill. But what we see is that when there are institutionalized working groups, when there are referred protocols, things work better, and this also leads to a better attention to the users and clients of social inclusion services. So we need a bit more formalization of things that already happen on the ground informally. So this is just an overview so that you can see that the existence of interdepartmental bodies in the autonomous communities is more or less widespread, but we still have some that do not have one for social inclusion. Coordination protocols are way more scarce, as you can see, and data sharing between departments is something that happens, but we have also seen throughout the questionnaires and interviews that this happens through specific requests from one department to another and not necessarily through integrated systems. And all of these could really help autonomous communities to go a bit beyond in this respect. And for example, you can see here that Navarra and País Vasco have these three ways of coordination mechanisms, and we have also seen that they have especially good outcomes in terms of social inclusion. So our third challenge refers to the adequacy of resources allocated to inclusion. For analyzing this, we did quite a comprehensive analysis across policy areas and indicators of the level of resources that were invested by the different government departments, so that we had this really comprehensive look at social inclusion and not just okay, how much is social investment? And something that we saw is that there were only 4 autonomous communities that consistently show a level of resources that is high across the different dimensions of inclusion. And these are the same autonomous communities that have better outcomes, and so that seem to be better in line with support needs. So the challenges for other autonomous communities include waiting lists, for example, in the areas of health or long-term care. Staff-client ratios, there is a lot of variation on the number of persons that correspond to a social worker by autonomous community, and this also applies to the area of health. We have also identified low investment in areas such as social housing, and benefit levels are not always adequate, for example, when compared with median household incomes for minimum income schemes. And in addition to this, and coming back to coordination, we also see that most autonomous communities show little budget coordination across areas related to social inclusion programs. So, challenge number 4, related to evaluation and continuity. Something that we have found that we think it's quite problematic is that there is limited continuity of social inclusion plans across planning cycles. So something that we have found a lot is that we looked more or less at the last 20, 15 years of social inclusion plans in Spain. And for example, we have a plan that is set in the middle of a time frame. It is created, it is implemented, it is evaluated, but then there is no follow-up. This happens in very few autonomous communities. Like, for example, I know that Galicia and País Vasco are doing this, and this works quite well, because if you have a social inclusion plan that builds on the evaluation of the previous one, then you really can incorporate that policy feedback. But we have seen a lot of cases when evaluations are done, but the policy feedback is not incorporated. Something that we have also seen that seems to be a good practice that helps in this sense is to have yearly operational plans. plans. This is done in Navarra, for example, and this really facilitates the incorporation of policy feedback if year per year the measures of the plans are assessed and also adapted to how they are working. And we also see that there is a need for a more systematic involvement of users and clients to really get the view and the perspective of the persons who are going to receive the service, both in the design and the evaluation, to better fit the policies to these individuals. And so one last challenge from my side relates to the effective use of digitalization. I have to be honest, data sharing is very underdeveloped at the moment in most autonomous communities, and this applies both between government departments and between levels of governments, for example, regional and local. So there is communication, there are information requests, but there is not a systematic system for data sharing. And this can really hinder doing like adequate policy planning, adequate evaluations, and also when a person comes into the social services office, having like a good initial assessment. In addition to this, which would be more of the administration side, we also have an issue related to digital exclusion and the fact that we know now that there are important digital barriers that faced by the vulnerable population who often lack skills and resources for making an effective use of digital resources and online administrative processes. And I think this is something that has really been highlighted from the pandemic, when a lot of vulnerable people were not really able to go and ask for a benefit they were entitled to due to not having the necessary digital skills of resources. But at the same time, what we find is that the solution for this is still very, very preliminary in most autonomous communities, and that few autonomous communities have developed assistance or training programs to overcome key digital barriers. So this would be it from my side. This is what we have found in terms of the state of social inclusion at the moment in the autonomous communities. And now I will give the floor to Herwig to tell you a bit more about our output too.
Thank you, Ariane.
The arrow down is the one that moves forward, because I was messing up.
I will stay comfortably seated, and I'm glad Ariane was first and not me. That's a reminder that technical issues can arise not only during Zoom meetings, but also in the real world. I will be extremely quick because we have some catching up to do, and also because the findings that I'm presenting are more preliminary than what Ariane just talked about. But it's important to give you, in order to give you an overall sense of the strategy of this project. So essentially the project seeks to establish inclusion challenges and good practices from two different sides. You've just heard about the institutional side, assessing basically what is happening, what the policies and processes look like. But we talk about integration, we talk about accounting for different needs. In order to do this well, in order to plan a framework for social inclusion, it is needed to actually understand in quite a lot of detail what people's barriers are that these programs are supposed to overcome. And that's what this element here is about. So we want to analyze the key support needs of the policy clients. So this is essentially the people-centered part of the project that has two different components. The first one is what I will be talking about here, is basically to map those inclusion barriers that we have referred to in a more abstract way already, but make this more concrete with actual data, and look which ones are common among the policy clients that we try to reach with inclusion policies. This title is a bit of a handful, so internally we just call this phases of poverty or exclusion, because that's essentially what it is. We try to describe the circumstances in a very of policy clients in a very practical way, if you like, put faces on the complex and abstract data, something that is more intuitive, perhaps also for a policy dialogue. A second part will look into specific support itineraries. What we mean by that is basically how long and how often people rely on minimum income benefits and what we can learn from that. I will not talk about this here, but that's also part of the project. So what are common inclusion barriers in Spain? What is shown here is basically just the steps that we take in order to do this mapping that I mentioned. And that involves basically measuring and quantifying different types of barriers to the extent that we can with available data, and then show their prevalence and also their combination. So are people actually facing multiple barriers? What implications does this have for wanting to make links and coordinate different types of support? Because just overcoming one barrier would not be enough to further inclusion. You need to work on different fronts, and that's basically what this exercise wants to show in more concretely. So the first step is to think, well, whose barriers are we actually talking about? So we need to select a population of interest. Essentially, what we are doing is to adapt the AROPE, the at risk of poverty or exclusion concept that you know well from the EU context, and look at those people as basically think that these are the people we want to reach with inclusion policies. And we try to then describe different circumstances, different barriers for them, drawing on household microdata. We looked at a range of different sources, also Spain-specific data sources, for instance, the data produced regularly by the FOESA Foundation, which is really informative. But in the end, we decided to use EU Silk, and we produced a document describing the pros and cons of different data sources and basically justifying the decision that we took. And we'll be very happy to share this with you. A second step is then to conceptualize and then to measure indicators of the barriers that I spoke about, and I will show some later. That depends on basically the information that is available in the data. But EU Silk is actually very rich. It has a lot of information on material deprivation, on health barriers, on the family context, on the labor market context, on the income context, and putting all this together, one gets quite a rich perspective of what might be the main issues that people are facing who are in that AROPE group. In a third step, we identify policy-relevant groups. So rather than just presenting overall statistics on the number of people facing different barriers, we want to see, can we identify individuals with similar sets of barriers? So can we basically identify clusters that might be important and interesting for targets, if you like, for inclusion policies. So, for instance, if there's a lot of people who have limited labor market experience but also care barriers, then the support measures would need to attack both these barriers at the same time, and that's informative when thinking about how to reach these people and what coordination might be needed between different programs. Finally, we will take this data back to the institutional side and analyze, well, are the insertion pathways that are currently in use, are they suitable, and where are they suitable to meet the different barriers that we have uncovered from the household data. So just jumping over this to make it quicker. Here just gives you a quick list of some of the barriers that we're looking at. And on the left-hand side, we actually started from a large set of potential barriers or obstacles, I think about 30, and then narrowed that down using a range of criteria. One is, of course, that it can be reliably measured. So you see, for instance, here, the share of missing values in the data is relatively low for those indicators that we have retained. We also want to include barriers that actually measure different things rather than being very correlated and all pointing in the same direction. So while there may be many more relevant barriers in some of the categories that are shown here, I think we don't want to make it more complex than needed, and we just select those that seem to be very telling in a statistical sense. We also want to include those that are obviously relate to specific policy areas that are of interest in this project, and you see some listed as examples in the second column. And we want to include ones that are relatively easy to communicate. Not all of them are, but many of them are quite easy conceptually. And I think that communication aspect is important to make this not so abstract. And just to give you a very quick first cut at some of the results across the entire population. So we see here basically the incidence of different barriers that were listed. For instance, you see a lot of people in the group of at risk of poverty or exclusion who have low education, not surprisingly. We see several affordability issues that actually one can expect to become much more critical as part of the cost of living crisis. So a lot of people, actually 30%, in the context of Spain, say they cannot keep their house reasonably warm. Others cannot afford medical treatment, such as a dentist. There's also a lot of people with migration-related barriers. So they were born abroad and potentially have difficulties integrating from a language side or other aspects from that end. And interestingly, also for the topic of income support, which is central to our discussion here, actually quite a few do not receive any income support, apparently. So that relates also to the take-up issue that we will be discussing later in the afternoon. Now, apart from the individual barriers, which are all quite interesting, it's, I think, one quite useful format of looking at results from a policy integration point of view is how many group face multiple, how many people in the group face multiple barriers, and you see that at the bottom here. So you see actually a large majority face 2, 3, 4, or more barriers, and this of course has implications for and points to the need for integrating services across different policy domains. And in the next step, what we will do, and I show this here on the last slide, is to actually translate this sort of more aggregate data into the phases of poverty and exclusion that I mentioned earlier. So we want to identify groups and clusters with similar sets, which type of barriers are typically combined, and what does this mean for service provision, and which may need to be tackled jointly, and how can we make support accessible. And then in a final step, we will take this back, as mentioned, to the institutional information that we have collected and do a sort of a gap analysis. Ask, well, what barriers are not addressed right now, or in what combination, but also what is working well, of course. And I think I will stop here, and I think we made up some time. Thank you very much.
Muchas gracias, Helvig y Ariane, por la presentación.
Thank you, Helvig and Ariane, for this interesting presentation. And thank you very much for respecting the time, because we're a bit on late. Thank you so much for the work that you are doing in the framework of this project. Thanks.
Do you want to say a few words? What happens now?
Yes, I'll invite everyone, and then I'll present this panel as well.
Okay, I'll stay seated for now.
So after the presentation of the project, we will now start with the first session on best practices from today, which will concern the topic of integrating different policy areas for a multidimensional approach to inclusion. And for this, I would like to give the floor to Joseba Zalakain, who will be moderating this session. Joseba is director of the C Center for Documentation and Studies of the Eguía Careaga Foundation since 2007 and has participated in different research projects in the area of poverty and social exclusion, long-term care, aging, disabilities, and addictions. In these areas, he has led reports on topics that are extremely relevant for these workshops, such as the right to social inclusion in the guaranteed income system in the Basque Country. Joseba, the floor is yours.
Thank you. Bien. Muchas gracias. Bueno, a mí.
Thank you so much. They've invited me to do the moderation, so I'm going to be the moderator. The first thing I'm going to do is some reflections on what's the main importance or need to think about the different tools, experiences, mechanisms for the coordination and cooperation and integration of the different well-being systems and these inclusion policies. I don't have much to add to what they said in the introduction, to what they said in the previous presentation, but I do think it is obvious. First of all, the idea of this double right, the policies in Spain when it comes to social inclusion recognizes two different areas when it comes to the income and also the right of the necessary supports for inclusion. Ariane has also mentioned a growing assumption of the multi-cause nature of this exclusion, and this drives us to the multidimensional nature of exclusion. So this is a fundamental element that we must bear in mind. I do also think it's necessary to highlight what they said before, the data, the different profiles of peoples which are users of these inclusion programs or people that are in the situation of inclusion. So on the one side, what are the barriers, the dimensions in their daily life where they find more problems? But we can also, from a dynamic perspective, we can see, and the data are showing us from the FONSA Foundation, when we do analyze this from a dynamic standpoint, what we see is that the accumulation of these problems of exclusion is growing. It's not that we have more people affected, but we have these people are accumulating more barriers, more problems. There are more dimensions in their life. So the need of arising this from a multidimensional standpoint, it's something essential. I would also like, before our colleagues doing their speeches, I would like to mention some specific barriers. Some of them are very important, which make very difficult to have this multidimensional treatment. We all know this. It's the way in which the public administrators organize their services, not related to their global needs, but to the specific needs, public policies that they do assess. I think there's another element which is not specific to Spain, which is basically general to all of the inclusion policies in every country, which is some kind of single view on this labor market access. We made this mistake between what was to work in the labor market, what was the inclusion of these people in the labor market. It doesn't quite relate to the multidimensional needs to these people in risk of exclusion. I think we all know that the quality employment, it's the first tool of protection. But I think we are going further into a more multidimensional social inclusion situation, which means for some people, employment it's not a mean towards inclusion, and we must work into other dimensions, like for example health in Spain, housing, care, political participation, general participation, etc. And other fundamental element which I wanted to mention now, which is related to governance and the leadership of the exclusion policies. First, to define what we understand by these policies. Anyone that has done some of these plans understands there's a great difficulty into what it is an inclusion policy, what people does this address. And we do have a governance problem, specifically in Spain, which is very clear, not when it comes to only coordination between the different areas, but the main problem we do have when it comes to social services has to do with how we coordinate the different actions of the different agents of the sector, the different town halls, administrations. We have a very fragmented map here in Spain with different capacities, different abilities. Some of them are unable to apply these activities. And also central government is developing new policies in this sense. These are more or less the barriers that we do face in Spain. So we can suggest different models of cooperation, of integration when it comes into these policies. And to talk about this, we have 3 different experiences, like specific experiences, but we are going to have 2 at the end with 2 different countries. So first of all, we are going to talk about more general experiences of coordination and integration in 2 specific countries in 2 different areas. And after the coffee break, we will talk about different mechanisms and specific tools. So in this first session, we do have, as I mentioned, 2 experiences. The first one comes from the United Kingdom, which is a country which I think has innovated and experimented a lot and they're very well done when it comes to these policies of inclusion and generating new tools for social inclusion, not only when it comes to income, but also policies for inclusion by itself. We do have Laura Adelman, who is lead analyst of employers' health and inclusive employment at the Work and Health Unit of the United Kingdom that coordinates the different ministries and also the Ministry of Work and Pensions of the United Kingdom government. And she is going to explain a specific experience of integration of 2 areas, of 2 dimensions or 2 policies related to inclusion, which is employment and health. So the floor is yours.
Introduction. That's a good start. Thank you very much. Thank you for the introduction, and it's a real pleasure to be here. When I was told it was a workshop, I was expecting 10 people to be talking to, but it's very, very nice to be seeing so many faces and, as others have said, to be face to face. The slides, thank you very much. As the introduction said, my name's Laura Adelman, and I lead the analytical programme within a joint unit called the Work and Health Unit within the UK government, and that unit reports to both departments, so really talks to some of the points you were making, Ariana, about the coordination. So this joint unit between 2 departments, ministries, the Department for Work and Pensions and the Department of Health and Social Care in the UK, came together to set up a joint unit in 2015, really recognising the joint agenda around work and health and the evidence base around the importance of good work for good health outcomes, and then having good health supporting those good employment outcomes. And we focus on the employment of disabled people and people with health conditions who may not actually be disabled. And that supports a range of government commitments around improving the employment rate and reducing the employment gap for disabled people, but also commitments around improving healthy life expectancy for for people in the United Kingdom. And one thing I wanted to stress is that, as you say, employment in of itself, not enough. We're thinking about both how to support people to move into work for those that have health barriers, but also thinking about how do we prevent people falling out of work in the first place for those that have health conditions, because what our data very clearly shows is that once people fall out of the labour market due to health conditions or disability, it's then much harder for them then to return into the labour market. And as you say, then those barriers increase. So our work programme, the policy work programme, covers a wealth of areas. I've mentioned a couple here on the slide around working, just as you have been in this project, in terms of how do we support local areas to integrate their local health systems, to think about work outcomes as well as health outcomes. We're working a lot on occupational health access, so supporting people have the right occupational health facilities when they are in work, as I say, to support people remaining in work. Occupational health is not something that's provided on our National Health Service. It's something that employers provide. And so we're very much thinking about that local setting, local health, local provision, but also employer provision. What can employers provide? What should they be doing? What information do they need to support people in the workplace? And then also thinking about people's return to work if they are out of work, and what support services, employment services do they need, recognising that it isn't just about a return to labour market, but addressing the health barriers, and often, as the previous presentations have shown, other barriers too. I'm speaking to you as the lead on the analytical side of this programme of work. We've been building over that time, since 2015, a body of evidence around what works, for whom, and in what setting. And as you were saying, Ariana, that really getting at the participants' perspectives as well, how they have responded to the services and the innovations that we've put in place. So mentioned, so we've had a wide range of trialling to build our evidence, and that has actually built on previous international evidence. So ahead of this joint unit being set up, the government had commissioned RAND Europe, many of you will know that organisation, to undertake a study to understand how we could improve employment outcomes, particularly around those with mental health conditions, and what interventions the international evidence would suggest could be tested in a UK setting to build our evidence. And they produced a number of recommendations around what could be tested, listed here. So individual placement and support, which has been tested internationally. Often this is a model for those with severe mental health conditions, and it's a place and train model. What we've been testing is, in a couple of local areas, does this type of intervention work for those with more common mental health and physical conditions rather than severe mental health conditions? And we're starting to get our evidence through on that, and Should we reconvene again, I'll be able to talk more about that, but some promising evidence around how the local, so it's been in very local settings, how they have been working to provide these services in a local setting. Another programme that we've tested internationally, it's called Jobs 2. We use the term group work because essentially it is a week-long group intervention for unemployed benefit recipients to improve their confidence and work search. And indeed, our evidence that we generated supported the wider international evidence that actually for those with higher anxiety, lower self-efficacy, they were more likely to see good employment outcomes after this intervention. The final one, and this is the one I'm going to talk about most, was a recommendation to place employment advisors within our England National Health Service's main primary mental health provision. So that is called IAPT in NHS, the National Health Service of England. And so we have been testing putting more employment advice within this health setting, this mental health setting. This offers all individuals who come into this therapy for their mental health conditions, all individuals, whether they are in work at the moment, off sick from work, or indeed out of work entirely, they are offered employment advice. And they can receive that employment advice throughout their clinical work due to their mental health conditions, often, as it says, that last 6 months. These employment advisors are trained specifically to be embedded within this clinical setting. And as I say, it's to support people enter work, but also to remain in work. And we've been providing this support so that it covers 40% of England, and it's delivered support for around 30,000 people in those areas. And what we have seen through our large-scale evaluation is that the impacts have been very positive, particularly for those that when they started their mental health therapy were out of work at the beginning. We are finding they are more likely to enter work than those that only received therapy and not the employment advice, and indeed their mental health outcomes improved further than those that did not receive the employment advice. So those going through the service were incredibly positive about the service when comparing to other employment support, because people had the time and space to talk about the issues. But also the therapists working on the health condition were also very positive because it enabled them to focus their time on the health condition rather than the time with clients being used to address employment issues, which now the employment advisors could deal with. So what that has led to is we have just announced, it was announced on World Mental Health Day recently, that this provision would be expanding to 100% of England. It is England only because it's devolved, health is devolved to our other nations. And this will increase employment capacity within these services extensively, and we should be reaching around 100,000 people per year once it's fully expanded. I just wanted to finish by touching on some of the lessons across the range of those new services we've been testing. So firstly, there is demand when we have employment advice within health settings. People are taking up that provision when they are in a health setting, and as I say, often comparing it favourably, that advice they are getting, to other employment services. Providing that employment support within a health setting can be beneficial for health and well-being as well as employment. But it is hard work. It requires dealing with a huge range of stakeholders and a considerable upfront investment to establish those ways of working and relationships that you need to support those positive outcomes by everyone being focused on both health and employment outcomes. I did want to, it's not on the slide, but I just wanted to talk about data as well. It is incredibly challenging, both for our evaluations. The data side has been a big challenge to ensure that we have data covering all the outcomes of interest, but also working in local services, having that connection of data, is a challenge that I think we all share. But to end on the positive around co-location, so our co-location of services, particularly as evidenced through this employment advice in the mental health setting, that has been a key plank of the benefit of the service, so that the therapist and the employment advice are co-located and therefore sharing experiences. So just a flavour of some of the things we have been testing and learning from in the UK. Thank you for listening.
Muy bien, pues de momento nos quedamos.
Thank you. This co-location idea is very important for us, for the professionals of the health system. If it's okay for you, later we can have a Q&A session for the two speakers. Now we are going to move on to the Germany speech, which is going to be via Zoom. So I think we already have Sascha Kummer, who is an Assistant Policy Officer at the Federal Ministry of Labor and Social Affairs in Germany. And the speech he's going to be done, it's going to be more into more general perspective of the integrated work done in the employment services, the social services, when it comes to the companionship of people receiving this German system of the MIS, and Sascha Kummer is going to explain what's the situation today, but also the reform projects of the model of companionship and intervention of these beneficiaries of the MIS systems of Germany. Sascha, good morning.
And thank you very much that I can take part in this international workshop on best practices for the design of social inclusion policies. Let me try to share my slides with you. Yeah, and I hope that you can, yeah, perfect, it looks perfect that you can see all my slides for the short overview about the basic income support for job seekers in Germany. Just to give you a short introduction about the social security system in Germany in case of unemployment, we have two ways to be saved in unemployment situation. The first way is that you have an employment promotion, and in which you are insured all the time as long as you've been working in Germany. That means as long as you work, you also pay into this employment promotion code. And just in case you get unemployed, you get a finance support from the so-called social code book number 3. And this book is contribution financed, and we have currently an amount of 38 billion euros per year in this unemployment and this employment promotion. And currently we have 835,000 people, entitled individuals, who get a financial support by this employment promotion. But I think the most necessary thing is what happens if you don't get back into work. What happens in Germany then? That means after a certain amount of 12 months and you didn't get back into work, you will be insured by the so-called basic income support for job seekers, which you can see on the right-hand side of the slide. This also is a financial support in case you are unemployed, or even like you've never worked before, but you are able to work. We want people to be, at least to have a basic income and to save their lives. This system is tax financed, and we have a volume of about 47 billion euros per year in this system. And currently, we do finance 5.24 million people in common households in this system. So what does the basic income support for job seekers is build off? We have two pillars on this system. The one side is the securing the social cultural subsistence level. That means you get an unemployment benefit. And it is also necessary for us that we still look for an integration into the labor market. That means you also get activation benefits in the systems. What individuals are entitled under the second book? Everybody in Germany who is who is an employable person and need age of 15 and over, and all their families, you must have an income and assess below the subsistence level, and your ordinary residence or right of residence in Germany. So this is necessary, and that means around about 8% of our households in Germany are right now in the possibility to get financial supports on the basic income system. Our composition of individuals entitled under the second book is currently, as I told you, 5.24 million people, and they do live in 2.67 million common households. We have around 3.6 million of employable age, and some around 1.3 million children under the age of 15 years. Currently, this is a database from November 2021. We have 865 people gainfully employed. That means 454,000 people are subject to compulsory social insurance. 265,000 people are in marginal employment, so-called mini jobs, and we have 74,000 self-employed people in the system. They all are not able to save their own lives by their own monthly salary. That's why they get the minimum basic income and social insurance. And in the systems, we do have also 1.5 million people who are unemployed, and even 804,000 long-term unemployed people. Just to give you a short overview on the development of the number of individuals entitled under this second book, You can see we started with our basic income system in the year 2005 and had about 6.3 million people unemployed in the system. Currently, this is database from last year. We have around 5.3 million. And the only point what I want to show you is, of course, we have a gap or load down under in the numbers. But what is also necessary to see is that we even had, like in the years 2020 and 2021, during the big lockdowns and COVID-19 pandemic situations, we didn't have an increase of the numbers. So that means we had also like different other types of social support to the people to prevent them for unemployment. The securing social-cultural subsistence in this unemployment benefits is a standard need at the moment of 449 euros for single persons. They also get an adequate housing and heating costs. We prevent or we give them health and long-term care insurance. And also they have, if necessary, they also get special needs education and participations benefits. This is especially for children in the households. In a total sum, that means a single person gets around 860 euros of basic income in Germany, and a couple with two children may get around 2,340 euros monthly as a minimum income. On the other side, as I already told you, we have also the activation benefits. And this is necessary for us because we don't just want to give people money for living. We also want to activate them to get back into work. And therefore, we have three important pillars. The one pillar is the instruments of employment promotion. That means we do give people counselings, placements, placement budgets, activation programs, and vocational integration measures. And we also try to give them continuing education and trainings, all to prepare and get ready for work again. Also, we give special integration services. This is, for example, back-to-work allowances or services for the integration of self-employment individuals, work opportunities, discretion subsidies, assistance for young people, and also we have a so-called social labor market to give easy access to work again. And the last pillar is the social service, or the services aimed to social integration, because this is necessary as well. What we found out is to bring people back into work, it is necessary to have, for example, childcare, or sometimes they also need debt counseling, psychosocial support, or addictions counseling. All our general principles, and the system is made out of general principles, so-called rights and responsibilities. That means we have the rights on the one hand, for example, the support provided by a personal point of contact, and we have the benefits and services for integration into the labor market. We also have conclusion of a job integration agreement and case management. And we're looking forward to the next year because the German coalition or the German federal government wants to renovate the system, and we want to start with a so-called citizen benefit in the next coming year, with new principles of cooperation as equals and trust, including a new cooperation plan to improve participation, abolishing the priority of job placements. On the other side, we have the principle of responsibilities. That means all options to reduce the need for assistance must be exhausted. So everybody who is becoming, who gets a social income has to be take part in, as a matter of principle, in a reasonable, be expected to take any job or any measure. And also it is necessary to know that if you do not pay attention, it is possible that you can get sanctions imposed for non-compliance with obligations.
Sorry, Mr. Kummer, you have 5 minutes. Sorry, you have 5 minutes to end.
And the next year, we want to start with the so-called citizens' benefit. This is the draft is right now under preparation. And in the citizens' benefit, we want to bring into a new focus on the individuals. The aim is that we bring on more respect, more trust, more social security, and less bureaucracy to the people. Also, we want to enhance in continuing education and training, and even we want to bring on long-term prospects and new opportunities on the labor market should be created, because this is necessary for us that we bring on people into work for long-term and don't want to keep them into the benefit systems. I don't want to talk too much about the reducing of benefits, but it is also necessary to know that all these basic income system is not just giving money to the people and that's it. It is also necessary that we always tell them your benefits can be reduced if you're not cooperating with the organizations, and if you do not cooperate, your unemployment benefit can be reduced. But it is necessary to know that our sanctions or our rate of sanctions is quite about just less than 1%. This is like just a short overview, and I don't want to bring it on too deep for you. This is how we are organized in Germany with to develop the basic income system. We have job centers. These are in total 405 job centers all over Germany, with approximately 74,000 employees. And these job centers organizing on the one side the social benefits, and on the other side they also are responsible for giving you the activation benefits. All in all, just to give you the overview how the system and the funding of the benefits and services under the second book are financed in Germany, we have two ways. The one hand is the federal government. We put into the system around 42 billion euros, and this is all tax financed. And the municipalities bring into the system around 5 billion euros per year. Last but not least, that you get a kind of a feeling what the expenditure of the social welfare state is in Germany. Approximately 30% of the GDP is spent on social benefits in Germany. Our federal budget in total is 496 billion euros. And for the basic income, as I told, we spend around 47 billion euros. Just to compare all these monies is for the pension scheme, we spent around 92 billion euros from the federal budget. And in total, we have 300 billion euros. And for the defense budget, to make it more comparable for you, we spend currently 50 billion euros. So what you can see is Germany spends quite a lot of money into the basic income, and it is necessary for us to prevent people from unemployment and to make them, or to give them at least a social basic to save lives and to be independent and to find a way back into work. Thank you very much for your attention.
Thank you. Hemos recuperado un poco el...
We've recovered a little bit of the time that we have lost, and so I believe we can have a 5-10 minutes for comments and questions to the two speakers that have participated in this round table. And I'm saying 5 minutes, not over 5 minutes, please. Would anyone like to ask questions in Spanish or in English? If you want to do so, please raise your hand and state your name and occupation. Thank you.
Bien, porque si no, sí.
Thank you very much. I'm Gonzalo Capriola from Slovenia. I have a question for the both of presenters. For the lady from the UK, I would like to ask how pervasive is the problem actually in UK? Could you give us a flavor? How much is has been covered by this program, particularly the third one, and the success of this program? And for the gentleman of Germany, I would like to ask him about exit and fluctuation. So people that come into the benefit and go back to labor market and come back again, and to which extent actually they are temporary or permanent individuals in the scheme. So how much of people are constantly to time in the program, or are just temporarily? How much is the ratio? Do you have an idea? Thank you.
Sorry. What we know is that for our trying to think of the best way to describe. So, disability in the UK, we measure according to our Equality Act. So, be having a long-term condition, health condition, that is expected, either has lasted or expects to last 12 months or more, and it affects your day-to-day life. And we know, I'm trying to remember the figure off the top of my head, but mental health conditions is a significant and growing proportion of our disabled population. I know often disability is thought of very much as physical disabilities, but that definition also covers mental health, and it often goes hand in hand with other conditions. I just haven't got the number top of my head, but it is one of the largest conditions. This particular programme covers in totality a small proportion of that because you need your referral to the health provision in the first place. To say that can come from your doctor, your general practitioner, but you can also self-refer. And one of the things kind of related to this, we know that some of the local services are also working with their job centres, local employment services, to also support that referring on, and that is something we will really be focusing on as it progresses across the rest of the country. And then our evaluation has shown, as I say, kind of increased employment effects, particularly for those that are out of work. It's a number of percentage, I can't remember the exact number off the top of my head, but a number of percentage points higher employment outcomes, and as I say, also the mental health provision measures improvement and recovery from the mental health condition, and again a number of percentage points improvement for those that received the service. There was a picture of our evaluation that has been published, and obviously if people are interested through the organisers, we could send more of the details.
So, Sasha, it's your turn.
I have to apologize because due to technical problems, I didn't understand clearly the question. So, is it possible just to repeat, please?
Can you hear me clearly? Can you hear me clearly?
Yeah.
Yes. So my question is about exit and fluctuation into the program. So how do you have any idea of people that come to social assistance and activation for job that come and go to job and come back again? So do you have an idea of this fluctuation on a permanent exit of this? And second, whether in the amount of 6 million on average individuals that are in the program, how much are permanent individuals or on permanent basis or temporary basis? Do you have an idea on that? Thank you.
Okay, yeah, actually this is a quite good, these are two good questions. And I'm sorry that I can't give you the numbers right now. Of course, we have numbers of people leaving the system and then coming back into the system again because they don't work not longer than 12 months. This is the necessary amount of months which you have to work to leave the system in total. So I would like to give you the numbers if you want to. I could write it to Ariane from the OECD and then I can give it to you. The second question about the permanent, this is like so we call them the long-term unemployment people, and in this situation right now we have around about 1 million people who are long-term unemployment, who are long-term unemployed, and this is like the basic of the base of the permanent people who are in the system. And of course we try to get or to bring them out of the unemployment situation. But we're talking about like around around 3 million people who are who are coming into the system and leaving the system, and around 1 million long-term unemployed. And this is like the basic, the base in this situation.
Muy bien. Muchas gracias.
Thank you very much. I believe we don't have time for further questions. We will have a 15-minute coffee break, and at 12:30 sharp, we will tackle the second panel. Thank you so much.
Let's try to all sit down, please, so that we can start the session. Perfecto, pues nos queda una última sesión.
We have a last session before lunch. Thank you to our previous speakers and to those that ask questions. Joseba will be introducing the second session. Unlike the previous session, in which we thought about some general issues related to system coordination and organization, and different systems in the UK and Germany, now let's change gears, go to a different location, and see a different outlook. Two specific experiences will be introduced here. One in Spain, in the Navarra region, and another experience in Italy. We will be explaining tools, mechanisms, special instruments to coordinate, cooperate, and integrate employment systems and social services. We will briefly introduce each topic, 15 minutes each, and then we will have some time for questions. Loli Gutiérrez is Director of the Primary Care and Social Inclusion Services in Navarra. She will be explaining the mechanisms and tools being implemented and embedded in Navarra to provide a coordinated response. Loli, the floor is yours. Thank you very much, Josema. Thank you so much, the organization, the OECD and the ministry for inviting us to this session to share our experiences. It has been very valuable to hear other experiences as well. I've heard a lot. Could you put in my presentation, please? There it is. Right now, we are deploying and developing two integrated care systems in Navarra. One that has to do with social services. We have the AUNA project, which has been financed thanks to the Ministry for Social Integration, and another project related to integrated care between the social scope and health scope. I will give you a few ideas, a little information on this, and I'll follow a general overview. Firstly, when we think about implementing any sort of integrated care, we must take into account two very important and significant scopes. The fact that we should think about this long-term, really long-term. We're just looking towards the horizon with long-term goals. And why? Because they presuppose a cultural shift more than operative. It's more about culture and structure. Another element is that it needs to be buttressed into permanent supports that are valuable through time. In the case of Navarra, due to integrated care between health and employment, We have started implementing this model in 2015 with 2 milestones that have anchored the model. First, we reorganized the organic structure of the department by embedding the employment service. Up until that point, it had been in other departments, and we have a very important law milestone with regulates the right to employment. We have implemented a very important project as well that has helped us define processes and has enabled us to understand lessons and tools that we have embedded to the original model. Currently, between 2022 and 2023, we are working on the AUNA project, and we have another important significant milestone, the approval of IMV, and in this case, the MIS, that has been implemented by the Navarra government. We have to anchor this into another project, which is a strategic redefinition of social services and primary care. Quite a lot to do, as you can see. The AUNA project wants to improve the efficiency to MIS people and also having a right to inclusion. We have 3 priority packages that I will touch on and 2 cross-cutting ones concerning management and evaluation. The first package is the integrated management of MIS, and we have a first phase, which is benefits, economic benefits within inclusion itinerary. We will be using 2 strategic acts. First, creating administration that depends on the Navarra government to be deployed on the area of project development. And also, we want to streamline this process so that social workers and educators can be dedicated to intervene without having to spend time on red tape. Another very important part is people segmentation through triage and division. We must understand that once we apply triage, we can channel people towards the most appropriate department so that the services are used more efficiently. Triage is a tool that we use in the Orsisi project when the case managers had 2 tools. And we saw that if we cross-cut more data, we would get more info on different profiles and thus better different results. And we would have a more customized response. We clustered it in 3 itineraries. A first option, people that are ready to be employed in an inclusion situation, this would be a result. And so the response of the administration would have to, people could be helped. And on the other side, we had people that were not available to be employed due to a kind of delicate social situation. And those people, just disappeared. Those people would be helped by employment services. And then there's a third profile of people that are available to be employed, and they can be socially integrated through employment, but their situation are not the best socially, and so they need a comprehensive intervention. This triage can be applied no matter the service in which the person is in, employment, social services, anything, but we can all apply the same tool and channel the person to the most appropriate resource. Concerning triage here, we have the CC project here. We have improved it, validated it with a co-project between 2 different universities, and right now it is online. So that if one person is being helped in social services, we wouldn't need to apply anything further. Here are screenshots of the app, and we can get a specific report on the specific profile of the person on a first level or a second level in which the person has received a referral. The second package relates to integrated care, fully, 100%. Here I gather elements that were within the regional law that we have approved concerning methodology and care. I believe that Joseba talked about this, about cross-cutting multidimensionality. So we need a pluridisciplinary assessment, how a person participates, guaranteeing that this person receives care 100% all the time throughout time, and their right to inclusion. In any integrated model here, we believe that this model needs to be buttressed in three main pillars. Not only the model of care that we have developed here, but also the case management model shared between several professionals, one a social professional and the other an employment professional. So here we are gathering all of the elements that are present in law. And then we have also designed processes, procedures that have to develop every single professional profile. Another element is diagnosis tools that are common to all. When we guaranteed the right to inclusion in law, we didn't have a common tool. So we embedded an assessment tool. We have designed another employment tool. Right now we are validating it. Plus, we also have triage. And also we have system interoperability. I'm not talking about shared system. I'm talking about interoperative systems. Because our employment system did have an information system, but beyond CEUs, we didn't really have an information system in social services. And also it would not give way to an integration service. So we developed the app, the System of Information of Right to Social Inclusion. We weren't very original in the name, and so we incorporated and embedded this process. We copied this also in Orientasare. Here's a screenshot. We can see CVIS up here, and how we applied it, we copied pasted it in the other app. We can follow the stages of the process, so welcoming, initial assessment, customized programs here. Everything that's in color are the stages that we have gone through with this person. And in gray, the ones that we still have to go through. And we have a final assessment, which is also very significant. This person can receive help from employment, and we open a file. Once he has gone through integrated care, the systems can intercommunicate, and the file becomes available in all different systems. We have common reports, common agreements. This is why I was saying that the systems are not integrated, they are interoperative. Anyway, thanks to all of these elements, assessment, processes, apps, we can establish a process. Of course, this is only a screenshot. I won't pour into it, but we establish which steps we need to follow, at which point do we need to go online, etc., etc. Just for you to get a general overview in a nutshell. The third package, here has disappeared again, is the integrated management for access to employment. This is done thanks to the cooperation of entrepreneurs. We will be signing an agreement with the entrepreneurs of Navarra. They will help, they will be a third party here helping to put us into contact with companies, a sort of broker. I would like to highlight an important act and action in the AUNA project, thanks to entrepreneurs in Navarra, which would be a creation within the site of an app in which one can include info on the project, and companies as well as participants can have access to this information online. I hope that in the future this will be successful. To come to a close, just to put the finishing touches here in AUNA, and right now I will showcase PAES, the project of integrated care between social services and employment services. This project is within the framework of the health plan that already exists has existed for a few years in Navarra already. As I said, that is its framework. It has been existing for a while now, but we have boosted it lately thanks to the extension of the integrated care network. And right now, practically half of Navarra is under it, and we have included support resources. In the health sector, we have personal support for the implementation of the model, and we have created a department within social services that is supporting absolutely everything. This is the flyer. I believe it explains things in quite a clear-cut manner. We are joining coordination between social services and the nurse. Okay, I know I'm getting excited. Wait, I have 2 minutes. Okay, I will close it. Gathering up what I was saying about the AUNA projects or the integrated association, we are seeing the same thing here, having to be buttressed in 3 pillars. We can see the governance system here. We have 2 different departments here. The health department, can you imagine the size, right? So we have deployed a governance system that is present at all levels, up to the technical part, and is also deployed in different areas. I believe this basis is extremely important. We also have joint assessment tools. We are using an assessment tools with a basic scale of social assessment. We have designed it and we are waiting for it to get validated. And the third element is having access to information systems. Due to data protection, this is proving to be quite tricky and complex. Here are contact information of AUNA and PAES, and please feel free to write us with any questions or doubts. Thank you. Thank you so much for the quality of your speech. We have the next experience here, Pietro Melzi, the external subject matter expert, SME, for the Lombardy region. He will be speaking of the coordination of several systems and how they have launched this, such as an online social card. I believe that he comes from Lombardy, but he will be speaking in Spanish, even though the presentation is in English. Good morning. To save time, we can just mix both presentation because we're speaking on the same things here. The presentation is very similar. I am Pietro, and with Davide, we have been doing the follow-up of the project of the Lombardy region. We started in 2016. The fact is, or my point is, I need to set the context for you to understand my words. Firstly, what is the cartella social informatizzata? We can say that is a tool with which social workers will be planning individual pathways. Since we're speaking of the Lombardy region, this is the first data source to plan, organize, and govern social work and services in the 1,500 city councils of our region. We, unlike Loli, have not designed a comprehensive solution, but we have a roadmap in which we can find any kind of information on social services. And you can find information on the different public bodies that work to help single people. To open, what is Lombardy? It is a big region on all sides. It has about 10,000 inhabitants, 10 millions, I'm sorry. The complexity and heterogeneity that we find in our context is immense. It is an immense region. We have 1,500 city halls, a lot of cooperatives, social agendas, and third sector participation that provide services on social itineraries. We have coordination mechanisms among the different players. There are huge issues concerning common management of social services, social works, and all services in general that help people. So health, employment, education, anything concerning inclusion pathways. My point is, there is resistance on the part of the main players, governors, directors of social policies, politicians, those that are in local governments. Of course, we have the problem here that is common to all. Public budgets. Public budgets always have a basis upon historical expenses. They are never based upon real needs of citizens. They are based on historical expenses registered in different communities and different city halls. Moreover, what do we think on services, really? What people think in theory is different than what actually exists in practice. True thoughts of people are something that is very different than something that you can read on the site, then you can. And so when we speak of mechanisms and tools, understanding what happens in the reality of social workers can be very useful for politicians and for directors of social policies. Imagine, in Milan, we have about 800 social workers and one director that has more or less, 200 people per worker. So imagine the load. One worker has to care for 200 people. So what are the tools to streamline, simplify, and coordinate the daily work of social workers? This is a very significant problem. It's also a problem of the citizens. The citizens are ignored in social services. And the most vulnerable people don't have the necessary know-how to help themselves, really. They need coordinators. There's also issues with intercooperation in administration. This is not something that citizens can do. They need to count on instruments and tools existent, really. Without them, there is no integration. Integration is extremely difficult. My colleague mentioned a piece of a datum that was very important. In Italy and Lombardy, public expense per person in health is 2,000 euros per 2 million, I'm sorry, per year. What about social work? 180 euros. Yeah, 2,180. So look at the difference. It is between an elephant and a little mouse, really. We shouldn't speak on integration. We should speak about the coordination of information on social pathways of each single individual. We need to think on how this coordination should help different public bodies. We have spoken on unemployment. In Italy, we have a policy that is very similar to the MIS, the minimum income salary. We will see later that there are some players that have to face the individual face-to-face. Some of those bodies are local, regional, or even national. And there is a lack of integration among all levels. Moreover, when one needs to think and define, to join all demands, you need to understand where are you placing these demands. Lombardy has a very important rule on a subsidy principle. There is heterogeneity among city councils. The Milan City Council, for instance, has to manage 1.5 million inhabitants, and some rural city councils have to deal with 40 people. So when the Lombardy region looks at this discrepancy, they need to understand the proper tools and mechanisms to homogenize our region. At the end of the day, the three main players have different demands. This means that we need a certain versatility because you have information on results and outcomes that end up on the table of major governors. So this information is quite different. The information received by authorities is quite different. We need to homogenize all of the results and information received by all the players. The social workers need to understand how to plan their daily interventions. They need to have a common language to speak with players of unemployment, health, etc. And lastly, come the citizens. Citizens must understand what services exist. They wouldn't need to have to translate anything. Many times, the names of the services mean absolutely nothing for the citizens. When you need help to clean your home, for instance, you need to look for a SAP service. And what is this SAP service? No one understands what this kind of name means. Why? Because the projects are written by governments and not by the citizens. We thought on a mechanism of coordination here. We have a guideline. And what are the most fundamental points here? This is an organizational process. It doesn't have anything to do with digitalization. We started by speaking to administrators and social workers on the standardization of processes. When I saw your process, I saw that is really in line with what exists in Lombardy. We have started by thinking, oh, there's a standard process in social policies. And this could be useful for all services. There's access, triage, identification, and then comes assessment, evaluation. Then comes the design of the social pathway of every individual. Then we have delivery of care to deliver benefits. And lastly comes a significant moment. We need to plan and close social pathways. We need to calculate how many people exit this social pathway and benefits and then come back. We don't know this. Why? Because this will never come to a close. Some people will benefit from this for years and years. In a nutshell, we have put on the basis of this kind of project. Five minutes, right? Okay, I will speak for 4. This is noticeable in the MIS scope. If the standardization is applied properly, we can have success. We have an app for people to request minimum salary called JEPI, and it follows this process in particular. This doesn't exist because the government of Lombardy has said so. The process informs of people's cases in general. So in a nutshell, the project was launched in 2016. So we had a roadmap that you can find in the site of Region Lombardia. You just look for it and you can download it, no problem. In 2016, thanks to the Director of Services, we created one of the first guidelines in common languages. And then in 2019, we started thinking about measures so that this model can become attractive throughout territories. The most simple and first measure was allocating funds so that the city council could buy and purchase this online solution. Second measure was the compliance of app solutions with the Region Lombardia guideline. This means that the city council could help people to understand if a solution was good or not. That way they could make sure that these solutions were based upon the same guidelines. We have 130 indicators here, lastly. That have been defined to help social workers so that all of this can become more attractive and easy to use. The last phase here, which is what we're implementing now, is a total dissemination phase, starting from 3 measures. The first is that we have conducted a survey with 600 city councils that have responded. In 98 districts. So they gave us data on their use of solutions. Secondly, we have been asking social workers throughout Lombardy about their barriers faced. And thirdly, we are drawing an improvement plan one per city council. I'll go quickly. When we started, 50% of municipalities had an informational tool, and right now it's 85%. 89% of social service workers are using the online solution, and beforehand it was only 12%. We have a common language throughout Lombardy, which before did not exist. We have increased transparency on service quality, on planning for social intervention, collaboration, and coordination among bodies. And we have reduced red tape and bureaucracy, and also the gap between both interventions. The fact is that in such a big region, the policies that have been drafted for one part cannot be used for the other. They're just so different. What are the next steps? First is using the available data to plan and define a model that can measure service quality. Secondly, our system should be more used, and we should work on that. Many bodies use it only for triage. They never use it when it comes to providing services, and so it should be used also by the third parties, the third party sector. And the cartela social culture should be implemented thanks to new tools. We need to embed this in workers' culture. And this is what we're doing, what we will be doing on the next phase. Thank you very much. I hope that my Spanish was understandable.
Pues muchas gracias, Pietro. El español ha sido perfecto.
Thank you very much, Pietro. Your Spanish was perfect and you respected the time. So now we have 10 minutes for some questions. As I said before, you can do it in Spanish or in English. While you're thinking about your questions, I would like to ask first to Loli. Laura mentioned how important it is to have this co-localization of the professionals that do the management of the cases when it comes to health and employment. And in the previous system, RC, and in the AUNA system, you have talked about these managers, couple of managers. So I wanted to ask how this idea is working of having two managers of two different cases, different systems. How do they work in a comprehensive, how do they work in an integrated way? How did you work when doing this comprehensive work? I don't know if you have used this co-localization formulas, or how do they integrate their work to managers that come from different systems? And in the case of Pietro, I wanted to ask you if this model of information integration and also ways of intervention entails just the work of social services, but also the responsible services for work, for example, or it's more a model of integrating information among the specific area of social services. I don't know if you understand that question. So first, if it's okay for you, Loli, well, we have gone through different phases when it has to do with the managers of case. In the RCC project, they were from the employment agencies, and the attention and support was delivered there. And in the assessment of the project, we came with the idea that it was a positive element for the integration of people because they were used to go to social services, and it does kind of normalize this when you are being assessed in this employment agency. And when this ended up, we started deploying the managing case in the natural way, which is what I call, which is the social services and also professionals from the employment side. And there we did face a reality which is the reality of system, not only cultures and the logics, but the most operative things like the area and the dimensions of the teams. For example, an employment agency with 2 managers was covering a basic area of social services of 10 social services with at least 10 professionals of the inclusion area. So the way of working here is to implement resources of follow-up, of support, of continuous work of the professionals that were delivering this integrated attention. So after the RCC was done and we started with this natural model, as we call it, everything that we have implemented in these 2 pilot areas disappeared. So that's a learning for us. The model by 2 managers has to be always supported by companionship resources, always. And now in the AUNA project, we have had to adapt to reality. We have had some difficulties to hire in both services. So we are managing this through hiring these 2 professional profiles through a design foundation, which is a public foundation from the department. So this is to try to perfectionate the model and then transfer it. So these managers were newly hired. They did not belong to these 2 areas, right? Yeah, when we did this selection, we did take care that these people, newly incorporated people, have already experience and expertise in these areas. We're working in this intensive and comprehensive training in the managers, so these calls required new people that were hired, but we're doing a great effort when it comes to training these professionals among their areas. When it comes to the social and employment, they are being trained in the employment area. And I forgot what I was going to say. Yeah, sorry. So we are working into a very powerful and strong training, and we have placed some resources of support and supervision of these managers into implementing these integrated paths. We're working on this. We do have 2 levels of employment policy. The one that comes directly from the provinces' town halls, which is in the model I explained. The model had this development in 2019. So the informations of the data and languages are now ready so that we can use these interoperable systems. So we talk from this cartella, the system we use, we can transfer data to the national system of employment. There are some areas of Lombardy which are more digitalized now, so they do have an interoperability between the 2 systems. There's an area of the region in which this is still not happening. There are some areas that from an operative standpoint are working more because they do have all of the information in this social system so that they can send everything to the ministry, but they do not have the connection. So I was talking to a friend from the minister, and I said to him, this is a very important topic, we have to work on this. In a town hall, as in Milan, in just this specific moment, there are around 8,000 cases of roll-up requests into the system, which are being worked from the town hall and has to be sent from the national policies of employment. And they do have everything done in the local system. And it's done with information and data, the useful data for the ministry. So we must understand how can we talk between the local level and national level.
A question for you. Something you said I found really interesting. The concept of closing, and that this can be sort of utopic, and some people just will not leave, at least not sustainably, the care system. So I think this realization in itself is really important for, for planning the process, for planning resources, for setting targets, but it's also important for assessing qualities. I was wondering, how do you, when you talk about, I mean, you showed the very impressive progress in terms of uptake of the tool, but I think you closed by talking about the next step, which is assessing service quality. How can the users, success or outcomes, how can that be taken into account?
Vale, voy.
I'm going to speak in Spanish, sorry. For me it's the same, so I'm going to finish in Spanish, okay? So this closing fact is something that has to be in the culture of the social workers. I completely understand that there are people that never go out or fall out from social work. When you talk to social workers, they say to you, not even when I die, I'm going to roll out from social work, because they do have problems with housing. Everything that happens is this. So if you do have to start planning and managing the data, what is the social work, you need to choose some rules to try to decide when to close this case. Maybe the case, it's when it's going to be started in 2, 3, 4 months, but you must understand when this case is completely closed. Moreover, we have started to understand which are the policies that can be evaluated with quality systems. So this is super difficult to do. We're just on the first step of this. I have heard, listened to you. I paid attention to everything you said, and we are trying to see how long are the social targets. So when you say these are the barriers to define the people that have these poverty problems, for example, we need to understand how many are the citizens that suffer these problems, because us, as communities, as town halls, as a nation, we are going to count the measures we have at our availability that are available for us. So this is the tool to see to which extent the social worker works well, is to see how far the people are that have these needs and that are, for example, doing the work from the public administrations. So we have started from here. Now we're going to see how many people are there for each problem, for each measure, how many people are really in charge, and we're going to see how many people have the problem. In the town hall of Milan, we have like 15,000 underage persons that have problems of poverty, of social exclusion, and the people who are in charge at the town hall is just like a very small amount of people. So the first thing is to understand the work that it's been doing from the administrations. It's a work that it's able to respond to the needs of the territory. This is the first thing. And the second one, which is much more difficult, it's the fact of when seeing in these social itineraries or paths, which are the measures that work better for a specific category, like a citizen category, and which ones worked better for other categories. This is super difficult. We're just starting to do this. In the manual of indicators, which is attached to this social cartella I mentioned before, we do have indicators to try to do this and understand this. If you are willing to know more, we can see this together later. There's a lot of KPIs, for example, that can be useful for this. And there's a long way to go still. We are going to talk about quality of social works maybe in the following 15 years, and I don't know if we're going to have a solution. because the thing here is that the heterogeneity of the cases, of the interventions, of the different places in which people live, it's huge. So we're just starting. If you never start, this never finishes, and we will never close this. So this is the first step. The first thing is to understand to what extent the policies are going to cover all of this. And the second one is to start understanding to which extent these social measures have a result per individual or per citizen. Let's see how it goes. Well, Pietro, thank you very much for you too. We do not have more time for questions, and we are going to wrap up the session with a brief summary with the main ideas coming up through these presentations and also on the first interventions. Thank you very much, Joseba.
I would really like to thank everyone who has participated in the conference this morning to present best practices that I think have been extremely valuable and I would say very relevant as well for the Spanish context. I would also really like to thank Joseba as a moderator for this morning's session on helping us with a tight time schedule and keeping the clock working on time. So I promise I won't take too long now, and we will very soon be having lunch. I only took like 6 pages of notes, so it'll be fast. So I would also really like to thank the audience for engaging with the speakers, as your feedback is really key for us in understanding the applicability of all of these best practices in the Spanish context. So I think that the morning sessions have highlighted a few things. The first one is that we really need to go towards systems that put the person at the center of the interventions, and this can be done through integrated service delivery. I think that something that said Joseba this morning that I thought was a very good summary of what we tried to encapsulate with this morning session is the fact that exclusion is multi-causal. So we need a response that it's multidimensional. So we need really to go from one to the other. And this entails having the person at the center of the intervention rather than just services building on top of each other. And I think this was really highlighted, for example, for the UK experience, where bringing the person at the center and providing employment advice and psychological therapy has led to better outcomes for recipients of these services, as Laura explained us earlier today. But also in the German case, which I think represents the development of a framework that acknowledges very clearly the need to go beyond income support if we want to design policies that actually get people out of exclusion. So of course, income support is necessary, but other policies, for example, they were mentioning childcare, psychological support, are also key when tackling this multi-causal exclusion that Joseba talked about earlier on. I think that the second element that has been highlighted by this morning session is that if we want to go towards more integrated provision of services and of inclusion services in particular, we need to establish the adequate mechanisms and tools to operationalize this. Because I think we can all agree at the moment on the fact that this is important, but how do we do it? And I think that this second session has been really interesting for having a glimpse of what can actually be done. Some examples that I want to highlight include the collocation of professionals, for example, in the UK experience that we heard about earlier today for work and health, or as we have seen in Navarra, for example, specific tools such as the triage methodologies that allow to what they are right here, to refer individuals to the most adequate policy itinerary for them as individuals. Also, for example, the multidisciplinary assessment of needs of policy clients that can really direct the person to the service that it's needed the most or towards an integrated response if this is what's necessary. And of course, I think that the interoperability of IT systems is key if we want all of these processes to work. And in this line, I think that the presentation from Pietro on the Lombardy region has really highlighted this as well, and also some core elements that may sound very intuitive at first, but that are not always in place in the administration, such as the fact that the standardization of processes or the establishment of a common language, right? Like we should all be speaking the same language if we are having the same person at the center of the intervention. This all leads to better quality and accessibility of social inclusion services. So wrapping up all of this, I think that this has been a very useful section, and I really hope that the practices presented here this morning can help informing the current momentum of reform that we are seeing in the area of social inclusion in Spain. So I will now switch to Spanish. Tenemos...
I think we do have 1 hour and 10 to have lunch. It's going to be upstairs. We will start this evening session at, okay, let me find this, at 2:45. We will try to be on time, please. And anything that you find interesting that you want to talk to us about the project during lunch, or you even have your email data, we will be delighted to listen to you, to read you. For us, for this project, it's very important to know how do you think, the way you think. The people that implement these policies are the most important ones, so thank you.
Good afternoon, everyone, and welcome to the second half of this conference. Wait, I think something is making noise here. Okay. So after a very interesting and engaging morning, and also after a very good lunch, I would say, we are going to start the second session, the afternoon session, which will focus on the incomplete take-up of social benefits. So this first session will focus on the drivers and consequences of non-take-up. And for moderating this, I would like to give the floor to Elena Costas, who will be moderating this session. Elena holds a PhD in economics from the University of Barcelona. She's a founding partner of KSNet, Knowledge Sharing Network. She's also professor of economics at ESADE, columnist for the newspaper ARA, and editor of Politicom. Her field of specialization is public policy evaluation, specifically in the areas of inequality, behavioral economics, and good governance. In relation to non-take-up, she has recently published a report on the impact of administrative formalities on the access to social benefits that I'm sure she will talk a bit about in a moment. So, Elena, the floor is yours.
Thank you so much, Ariane. And thank you to everyone. It is a pleasure to be here, and especially talking about this topic. Voy a hacer la sesión en
I'm going to do the session in Spanish, and then in the Q&A session, we're going to start in English. I think as most of the people here, from one side or the other of the administration, I have dedicated my life to try to do better public policies, especially those that refer to reducing the levels of inequality and poverty. And this has to do with the problem of the non-take-up. We can think about design good policies, implement these policies, deploy them, but if we set aside or we forget about that these policies and tools are really reaching people that we address and people that need them the more, if we miss that question, a great part of our work is completely useless. And I think it will be interesting to have these two people that are sitting here besides me who have a lot of experience. So let's think about the social benefits. For example, if we do not analyze in which way it's designed and provision, it's setting people like outside, we are investing money in things which are not useful. And that's why social innovation is so important, to think about in which way we can reach those that difficultly are identified, the barriers we can find. This morning has been very interesting to listen to the work from the OECD to understand which people are not receiving this provision or services. Maybe we are finding some problems in the norm. The norm, the way it is defined, it's leaving many people behind. It's difficult to understand. Maybe some digital barriers. The way we use technology in a way that makes us be more approachable to people and not the other way around. And we are also talking about some areas like, for example, bottlenecks. So we do have some problems that overburden problems, saturation problems, overcrowding that make these policies not to reach people. The problems that we do have in Spain about the non-take-up, we need them to be more precise, right? Are quite alarming. The SME, it's quite show, but in the communes autonomies, we do have a lot of experience now. And if we start comparing how many people are living under poverty situations, have an access to these benefits, it is quite alarming. We do have the País Vasco, we do have Navarra, and also Catalonia. We know only 10% of people suffering from poverty, they do receive these benefits. So it's a huge gap that we must address. The IDEF presented this summer the first paper about these SME, MIS, and they did show an 80% of non-take-up of families that are not receiving these benefits. So this is from the ministries to try to be adjusting the situations and things that we can do even better. But in any case, in these papers, there are some specific recommendations to know better what is happening in our country and having more innovative idea on how to solve the situation. So in this sense, we do have two people here with the appropriate and best information to be able to answer to this. As Ariane mentioned, from Caisene, we work with the third entity of Catalonia to try to address this non-take-up, to see which barriers can be rising so that some people cannot access to these benefits. So we did 4 case studies, the MIS, and also 2 local benefits, one to pay the emergency rent and also another one for aid or help to children or young people. And we did a kind of chronology. Since I do have this need, since I need these benefits until the moment I receive it, what happens in there? And what we got from this is basically so many obstacles that we were finding. And in these 10 steps that we wrote down, the probability of falling, it was huge. Since I have this need and I receive it, I'm going to have 10 big obstacles that will make my life basically impossible to receive this benefit. So we did analyze the situation of these people. So the first thing is to know, to understand, like, I need this thing, I need this help, this benefit. So sometimes it's difficult to calculate which kind of benefits I can receive. And secondly, we need to obtain the information. Okay, I know I need maybe the social benefit, but then how can I know what benefits are there? Do I go to my town hall, to what authority? Do I ask to my neighbor? Maybe my neighbor knows about some benefits which are not the ones I need. Another step which is important, and it will be interesting to listen to them, it's basically the stigma. Here it's a huge work to do to try to non-stigmatize the access to these benefits. And COVID, in this sense, brought new demands, new requests. The pandemic has made many people that never need a benefit before now need it. And this is a barrier to ask for it. Like, I don't want to see myself in this queue, like with these other people, because I didn't need this before, right? So, okay, I have the information, I know what it is, then I need to start this enrollment process or this application process. So we find many people that think or see that this access, this enrollment process is very difficult. Like, for example, we have to give to them this prior appointment option. Like, for example, if they cannot do it online, they do have the ability to have this prior appointment so that they can go and find the assessment of a real person. Then we do have the requisites when we analyze the helps and the aids and the benefits to try to see what requisites they are demanding. And here there are many questions like, you need to be 23 years old to ask for this MIS. And if you're under 30, you have to demonstrate that you've been living in an independent way. Like, why? Why an adult person that needs and access to the social benefit needs to say he's 25 and he's living without his parents like for years, for example? No, we need to be coherent on the requests, like to find the relationship between what you need and the benefit you're going to receive, but not to have these requisites, to demonstrate all this. In the case of Italy, we could see this. How can I demonstrate to the administration that I comply with all of these requisites? Maybe we're demanding too many information that the administration already has it, but the information, it's from a different ministry. So then here the task is not for the citizens. It's a work from our side to try to share this information, which is something we mentioned this morning in every speech. And also the communication with the administration, the language, easy words, also times, the schedules, because maybe you are asking me to send you a copy of my documents, for example, my ID, and I need to send it in 10 days, but then you can reply to me in 2 months. What's that? So the requisites we are applying to each of the members, and the last barrier we mentioned, we may forget about this, but it's important to mention, it's the renovation of these benefits in aids. So, for example, this is from the work of the OECD and from the ministry. Many times we are emphasizing in the person that has received this benefit. But if I do need it again, do I have to start everything again? Or if I don't make this in time, do I lose it? So this renovation process is very difficult. Without further ado, I just want to say it's very important, this idea of let's do a good diagnosis of what's the non-take-up causes, who's there. It's important to have good ideas. The work that Sarim Hamati is going to explain later, she's been doing some research on studies and evaluation of statistics in France. And her investigation is going to be very important to give us a good idea of the non-take-up in France as in other European countries. Whenever you want.
So glad today to assist to this interesting workshop. So thank you for the invitation. I present myself. So I am Anna Fissirin. I am a doctor in economics, and I was working for 3 years as a postdoctoral researcher at the DRES, which is Direction de la Recherche, Research Studies, Evaluation Studies and Statistics of the Minister of Solidarity and Health in France, and also at the University of Paris-Créteil. So the aim of the project was to measure non-take-up of social benefits in France. And so I was involved in like 3 projects. So the first one is to measure. And I think it's interesting and important in order to understand non-take-up, the first step is to measure non-take-up, to be aware of how much people, because it's good to have social benefits and with a generous system, but it is important that everyone could access to these benefits. And there is, and non-take-up is a very important issue that should be taken into account. So the first big project was to measure non-take-up in France of social benefits, and the second one, so we have conducted a project, a study on a comparison in the way of measuring non-take-up between 5 European countries. And also we were working on the determinants of non-take-up. So what are the factors that could impact non-take-up and what can make people do not ask or do not take up for a benefit. So as I said, the aim of the project was to provide a regular and contemporary measure of the non-take-up of social benefits in France. So it was a project in order to fight against poverty. So that's why I was involved in this project. And initially, the non-take-up of the revenu de solidarité active, which is the income of active solidarity, and also the prime d'activité, which is activity allowance. So the income of active solidarity in France is the last safety net of social security. It is a differential allowance that is designed to supplement families' initial resources in order to reach a guaranteed income, which is guaranteed income threshold, which is computed according to the family composition and the situation of the social household. I mean, the resources, the activity status, etc. Moreover, it is a socio-professional support system in the sense that it is also engage people in searching for jobs and also accompany people in order to find jobs. And it is granted for 3 months, which means that it's reassessed each quarter, and the amount is until 580 euros per month for a single person without children. So we have approximately 1.9 million recipients each month, with a significant increase with the COVID crisis in 2020. The prime d'activité is rather a work income supplement that is only allocated to people that are already working, but the working poor classes, working people. So hope I would not enter to many technical details, but the paper is really, I will talk about data and the way we have computed, estimated, let me say, the non-take-up. So in order to provide the measurement of non-take-up, so I can say that it is an intricate exercise, because to measure non-take-up, we need 2 main components. So the first one is that we need to obtain a most complete information to simulate eligibility. So we need to know family composition, income, activity status, etc. So this is the first. So we need a very rich information about the situation of people, and especially with the complexity of the system. So sometimes there are many rules, and so we need really to encounter many huge information. And on the other hand, we need to obtain a reliable and consistent information on the situation with regard to the take-up. So we need also to observe the take-up. And confronting the eligibility part with the observation of the non-take-up or the situation of recipients, it is possible to detect non-take-up, which is the situation of being eligible without receiving a benefit. So the exercise is much more complex for the RSA and the prime d'activité, since we need to have a social household perimeter, so it's not like a definition of a standard household. Moreover, we have, as I said, the complexity of the system so requires to have a broad and to constitute a broad resource base. And the specificity of the RSA and the prime d'activité with the quarterly assessment of means needs that we have an infra-annual variation of resources, which is not very evident to obtain. So I will present the way and the data that we follow in order to measure non-take-up, and also the results. And I will finish by the comparative analysis on the estimation with the comparison between 5 European countries. So let's talk directly about the data. So the data that we have used in France is the Tax and Social Income Survey, which is a socio-demographic information from the French Labor Survey. So it is a large sample that is representative of the French population, but in ordinary households at metropolitan France. So this data is merged with social administrative information from the CNAF. So the CNAF is the Caisse Nationale d'Allocation Familiale, which pays for the benefits. So we have a match with the data, so that's why we can observe, and we have like a precise information on the recipients. And it's also merged with the income declared to the tax authority, so data from tax authority, which means that we have also relevant data on income, of people income. So the ERFS is the reference source at the national level for the production of statistics on income, standard of living and monetary poverty in France, and it is the main data used in the socio-fiscal microsimulation model called INES in France. So socio-fiscal microsimulation models are used to simulate legislation and to evaluate reforms, etc. And that's what we used also in order to simulate eligibility. So non-take-up estimation, so from the ERFS, we could say that it is possible to simulate eligibility by socio-fiscal microsimulation, since we have a wealth of information on the personal situation of respondents, and also we could observe the take-up because we have the match with the administrative data. So this confrontation makes it possible to consolidate the measure, but there are some limits. So I will talk rapidly about the limits. So the first limit is that the field, as I said, is that it is limited to only ordinary housing, and I think this is a common problem of many countries in the measure of non-take-up, because we could not encounter people that are living in the street, for instance, or in mobile residences. So these people are especially vulnerable, but we could not introduce them in our data. Moreover, incomes are aggregated at the annual level. However, for the RSA and prime d'activité, we need to have a quarter information. So we need to make some assumptions in order to quarteralize data. Social benefits are also aggregated at the household level and not the social household. So we make also some assumptions in order to pass to the social household level. We have also two problems. I will talk just about the second one, which is the quality of the eligibility simulation. So when we simulate the eligibility from the RFS and we observe the take-up, we have a phenomenon that is also common to all countries when they measure non-take-up. It is the phenomenon of beta error, which is the fact that we have people that are observed as recipients but simulated as non-eligible. And we have found that this error was small and mostly explained for the RSA. With only 70%, but for the prime d'activité, it was significant and dimly explained with 39%. And for the prime d'activité, we say that it is because it is allocated to only working people, so we need much more relevant data on the infra-annual variation of resources. So that's why the quality of the simulation for the eligibility is not perfect. So that's why we have decided to only conduct a measure of non-take-up for the RSA, but not for the prime d'activité, because we have the problem of the quality of eligibility simulations. So for the results, we have found that in 2020. So for the RSA, on average, we have 1 out of 3 households that are in a situation of non-take-up each quarter, which is equivalent to 3 billion euros that are not paid per year. Per consumption unit, we have found that non-takers would not receive 330 euro per month per consumption unit on average, which is equivalent also to what recipients could perceive, which is very considerable. We have also conducted a measure of permanent non-take-up during the year, and we have found that 1 out of 5 households are in a situation of permanent non-take-up. I will pass the descriptive part on the characteristics, and I will just say 2 words on the determinants, because I don't have time to present everything, but we have an ongoing study on the determinants, and we have tried to include some original proxy for the quality of administration, for the stigma also, to know if these factors could impact non-take-up, and globally we have found that the stigma is is an important issue that constrains the non-take-up, and that constraint, the take-up, not the non-take-up, and also we have found, for instance, that people that are living in departments in which the quality of the administration is good in terms of treating the applications are less likely to be non-takers. Also, for instance, people that are living in departments in which there are much forth and back in order to bring some files, etc., are more likely to non-take up. So just and this study is ongoing, and we will try to finish it in order to provide the final results. And I will finish by a comparative analysis that we also conducted in order to see. With choosing 5 European countries: Germany, Belgium, Finland, Netherlands, and United Kingdom. So it was a study on these 5 countries that have different traditions of measuring non-take-up of social benefits. So we have also selected allowances that are similar to the RSA and the minimum income in France, the less safety net of social security in each country, over a time span of 10 years. So it was just a review of the academic literature between sociology, political sciences, economics, in order to assess the methods that are used to measure non-take-up in each country. So just the first result is that non-take-up is a widespread phenomena in all the countries studied. Whatever is the nature of the study, whatever is the measure, because there are much ways, let me say, to measure the non-take-up, to consider the beta error, we could choose to include it in the measure or not. So whatever are these methods, non-take-up is a widespread phenomenon. So we have, to talk about data, we have 3 sources of data to quantify non-take-up. So the case in France with the ERFS is a data from a general population surveys on income and living conditions. This is also the case in Germany with the German SOEP, France, so with ERFS, Finland with the IDS, and the United Kingdom with the FRS. So this is the first type of data, and it's the most common one. We have also data from specific one-off surveys that is targeting non-take-up. So before our studies with the RFS, there was a study in France in 2011 with a specific survey for non-take-up. This is also the case in Belgium with the current take, so it's called the Take project, with using a specific one-off survey, and it is, but let me say the disadvantage of this data is that it is very costly, and it's not, we cannot provide each year or each 2 years, it can't be regularly produced. And the third type of data, as the case in Netherlands, is data that is only from local administrative database matches, like municipalities. So we have data for each municipality, but only local administrative. So we don't have any much of data. So each type of data has its advantages and limitations, but the most common thing also is to, anyway, to simulate eligibility. So in each country we have a micro-simulation models that are based commonly on data from general population surveys. All measurement anyway, whatever is the way and the data, remain approximate, because anyway the data can never perfectly reproduce the complexity of the legislation. So so this is the last slide, to talk about the main actors that produce estimates of non-take-up. So we have either public statistics or research university. But the common discipline is economics. So the estimates of non-take-up are sometimes difficult to include in the public debates, but would help to frame the phenomenon of non-take-up. Moreover, statistics on non-take-up, so as I said before, can also be used as a government tool for steering public policy. So the case in the United Kingdom is that there is an official data that are reproduced by the statistical services of ministry, as in France also. So this is the initiative to do it. And much more in the Netherlands, for instance, municipalities use their local data in order to identify non-takers in a proactive approach to opening up rights. So just not to have the measure and just it, or to try to, but in the Netherlands, they really use their data in order to target who are the known beneficiaries and try to inform them, or to have a way in order to have an automatic right. Yeah. Thank you for your attention.
Thank you so much, Rin. Really interesting and so needed, this kind of job. And now let me introduce you Agnes Gray. He's the director for the Universal Credit, Employment Support, International and Corporate Support at the Department for Work and Pensions in the UK. Today he's going to explain us the Universal Credit and how UK has succeeded so much in reducing non-take-up. Thank you.
Great, thank you very much, and thank you to OECD and other hosts for inviting me. I used to run the European Social Fund in England and miss getting together with my EU friends, but then we did leave the party, didn't we? So I'm also really pleased to be invited because it feels like we're doing something right, and that's not always true, and especially if you look at the news at the moment, I don't feel like we're doing very much right at all. And in fact, every time I leave the UK, something bad happens. I went on holiday in September, and Liz Truss was elected, and the Queen died. And I'm here today, and I have a new head minister that I had to be on the phone to earlier to brief. So watch out if I leave again. And I always feel a bit inadequate on these panels. I don't have a PhD, unlike these two ladies. My language skills are awful, but I have been working in the Department for Work and Pensions for 30 years, so I do know some things, and I have a great team who know even more. So, as you said, I'm going to talk mostly about universal credit, which is our main sort of income replacement benefit, and it does feel like a success, but also because I'm English and I prefer problems to solutions, I'll touch on two other areas where I think the story is perhaps less good. So first of all, a bit of a picture of and this is only a slice of it, I would say. These are the my department's benefits that we either pay directly or we are responsible for the policy of. And some of the smaller blobs will get even smaller over time because they're being replaced by universal credit. But there will still be other things going on, and I think that's one of the lessons about take-up is, and that we haven't cracked, is that if you make your system complicated, people won't understand what they're entitled to. So, for example, if you are disabled, you are eligible for both universal credit and for what we call our disability benefits. Those are benefits designed specifically to help people with the extra costs of being disabled, and they serve a different purpose, and so the assessments are different, but it is entirely possible, despite the fact that we administer both, to be on one and not realise that you're eligible for another. So universal credit, I mean, I think the first thing to say is I think it's an integrated product in two ways. It integrates 6 previous benefits into one, and it is as well as being a payment, it's essentially a system. So it's designed to provide work incentives. It's linked to the help you get through the job centre. So we have and I think this is true in many countries now, but it didn't used to be true in the UK, where the social security system and the employment system were separate. But for quite a few years now, they've been together, and universal credit is a shining example of that, I suppose. So we focus on work at the beginning. The first thing you have to do is to once you've given us your personal details, you have to have a conversation about work. You get allocated a work coach, as I'll come on and talk about the detail in a bit, but the incentives are much stronger than they used to be in the benefit system to get work, because you keep more of the money you get from employment. One of the really critical things, and it was because it was one of your, I can't remember you used a technical term, but the sort of moving in and out of benefit, one of the good things about universal credit is because you can get it if you're completely out of work, but you can also get it if you're in work on low pay and you stay on it, and the amount of benefit just adjusts to your circumstances over time. So you don't need to worry, I'm going to go into work, I need to close my benefit claim, then I'll have to claim again later. That is not how it works. So I can answer questions maybe in the break about some of the detail, but it's the main source of income for people who are out of work. But as I said, it also is available as you move into work. We have this thing called a taper rate, so it means that you keep 45 pence of every extra pound you earn as you go into work. So we reduce your payment, but not entirely. So it always makes sense to work. And there are sort of elements that are based on whether you're a single, whether you're a couple, whether you have children, and then we pay so those are standard amounts. We then pay your housing on top of that. And if you have childcare costs, we'll pay up to 85% of those as well, all in a single payment. And I think that's one of the things which potentially improves take-up compared to the old system. So if you know you want housing support, you claim universal credit, and you might get something else too. Or if you know you're out of work and you hadn't realised there was help with housing, you don't have to ask for these things. You just get asked questions about yourself, and then you get everything in the universal credit system which you're entitled to, so you don't have to remember to claim separately for children or whatever. And then I think this is one of the other things that I think the reputation of the system is improving. It's quite modern and slick. So we are linked into the tax system, so we know how much people who are claiming universal credit are earning directly from the system the employers have to put in every month into the tax system. So it's not the individual's responsibility to say, I earned £500 last month. We already know. So it's very smooth. It's very easy. The amount somebody gets adjusts itself over time according to what they're earning. And then there's lots of other whizzy ways in which we validate your identity and so on. So it's a sort of online service that's a lot easier to navigate. Having said that, and I don't think it's covered on the slide, but there are we contract with a voluntary sector organisation to help people who are digitally excluded or need other help to claim, so you're not left entirely on your own to navigate this system. This is for the economists in the room. I won't go through the detail of this, but essentially the picture on the left is how the old system used to work, and you can see there are a series of sort of sharp rises and cliff edges about how your income would change depending on how much work you do, whereas the thing we call the taper in universal credit just ensures a much smoother gradual rise in your total net income as your earnings go up and your universal credit award goes down. The numbers have been growing overall, and this is partly because it's replacing the old benefits, so you can't make a claim to the old benefits anymore. But it has a lot to do with something that happened in March 2020. And this is being slightly too facetious, but if you want to drive take-up, then having a recession on the back of a pandemic is quite a good way to do it. Suddenly there were millions of people in need, and they knew where to come, and they came to us, and now some of those people have moved back into work, but are still entitled to benefits, so they've stayed on the caseload, which is why unemployment has come down in the UK, but the total levels of universal credit, you can see, rose and then have stayed high, which is a mixture of disabled people, people in work, and people who are unemployed. And so this is, two colleagues have to close their ears here. I'm not convinced any of this is evidence-based, but these are our views on what has helped take up. So I think the simplified process and the fact that it covers people in a range of different circumstances, the fact that it's sort of tiered and you add on the elements, all you need to do is to tell us your circumstances, not tell us what you want to claim. You only have to deal with one organisation, whereas at the moment, if you were unemployed before universal credit came along, then you'd have to come to us for job seekers allowance, you'd have to go to your local authority for your housing costs, and then you'd have to go to the tax office for your what we call a child tax credit, so for extra payments for your children. It was definitely likely that, I think that should say did not, that some people didn't claim their full entitlement, whereas now if you make any claim for universal credit, you get everything you're entitled to. And then this sort of single claims process linked to a work coach and so on is a simplification. And then I think, though I've already described it, but I think these moves into work are the other key thing. So you can go into work, you stay on universal credit, even if you earn so much that your universal credit becomes zero, you still are allowed to stay on our books for 6 months before we close it down. And then it's very smooth to go. If you've then lost your job, your circumstances just automatically adjust. I then wanted to talk about a thing we call pension credit, because the story here feels less good. So this is for pensioners. Everybody who reaches state pension age receives a state pension, but depending on your national insurance contributions, how much you've paid in, some of that will be relatively low, and so there are people in poverty, and so we introduced a thing called pension credit, which is an income top-up, essentially. And although 1.4 million pensioner households receive it, we reckon that's only a take-up rate of about 62, 63, 64% or something. So there are large numbers of people who aren't receiving it. And as others have said, we think the reasons for that include mainly not thinking you're eligible, or indeed potentially not ever having heard of it. and then some stigma about, I think people feel okay about a pension because they feel like they've contributed, but an extra top-up has more stigma attached. But we've been trying to drive take-up this year, in particular through a national TV advertising campaign. I don't know whether there would be any fans of Strictly Come Dancing in Spain, but anyway, the dancing show, one of the old judges, Len, was a big star of this TV campaign, not just government ministers. So that, I think, and it gave us a headache because it was quite successful, and then suddenly the people processing the benefits didn't quite have enough staff, but it's a good headache to have. And then I also wanted briefly to touch on disability benefits. So these are the ones with the extra costs of being disabled. And here, I think the simulation pretty much that you've managed to do in France would be impossible because it's based on a health professional's assessment of your ability to do certain activities, and so that data doesn't exist anywhere else. And we've seen demand go up, and I think that's partly because we've seen separately prevalence of disability go up. But I reckon, again, non-evidence-based, but this year cost of living crisis means, and the rate of inflation means that people will be asking around what other support exists. And then there's quite a lot of information available, and I think what helps on take-up of these benefits in particular is the non-government sources, so whether that's local welfare advice or if you're hospitalised, you have a stroke or something, you are pretty much bound to be told as you get discharged that you should be claiming one of these benefits. And so finally, these are just my personal observations, but in order to make this sort of thing work, you need a system which is widely known about, and I think I think in the UK there's a fairly deep cultural sense that people know the welfare state exists. We talk about it a lot, and so they're reasonably likely to know that there might be some help. Although we do have time, I think you mentioned timing. I think there is a gap sometimes, particularly for people who think they will be able to get quickly back into work. They often delay their claim to this benefit, assuming that they won't need it. You need it to be easy to understand. Now, no income-related benefit is particularly easy. You have rules about how much savings you're allowed and how much income you're allowed. But if you can simplify some of the information available, and we have some really good benefit calculators on the internet, I think all of which are provided by third-party organisations, so that you can work out what you would be entitled to. There's then something about ease of access. And then finally, if it's not just the government, and maybe this is a UK phenomenon, but anyway, if it's not just the government talking about it, but it's promoted by stakeholders, other people you trust, then I think that will help. So that's my story.
Thank you so much. Thanks a lot, Angus. It's great to know the different ways and how innovative you are on finding solutions for the different holds. I think we still have some minutes in case that someone from the public has any questions. Otherwise, I can send you some. So I hearing you, I just got two different questions, and it's for both of you, so I just give you both and you can decide on what to reply. On the first one, Serene, you talk about that, about how we measure and how we reach that people that is in an irregular situation. So we may talk about people that is living in the street or people that have an irregular administrative situations, but how do you deal with that if you can? And also how do you try to reach that people? And the second one is that in the IREF, in the Independent Authority for the Fiscal Studies, that did an evaluation on the minimum vital income here in Spain, something they found, it was that there is a lot of non-take-up in the people that get just a little. So I don't make the effort of entering to the system if I'm not going to get so much. Do you have any evidence on that, or maybe in the different ways you have tried to resolve situations, you are also attending that? Those are my questions, and there is another one there. Okay. And yeah. So.
Let's take the other people first.
Okay.
Yes, there's a lady here.
Yeah.
Buenas tardes.
Good afternoon. It's more than a question, rather than a question, is a thought concerning the obstacles you were commenting on. That is, the fact that people don't access their benefits due to lack of information, stigma, how regulations work. I believe that in Spain, yes, our population is pretty ignorant in that sense as well, because some benefits did not cover the needs of the citizens, and we were aware that they wouldn't cover the needs of the citizens. The message was clear. This was for people that have nothing. So when benefits are more universal, people are not aware that it can be for them. For instance, the MIS is said to be for people that are in poverty and exclusion. Many people are going to read that description and not be aware that they are this group, they are within this group. So the messages really showcase that our population is a little clueless, and they may not recognize themselves as being able to benefit from this. Thank you. Last one.
Thanks a lot. Serena, one of your, I think what's really great about your study is that you spent quite a bit of time looking at the drivers of non-take-up, right? So you did not have so much time, so I just wondered if you could say more about one of the things you mentioned, which is that sort of in the good quality administrations, take-up is less of a problem, right? So is that, could one reformulate this as saying that in the in the lower income administrations or departments, the problem of take-up is bigger because administrations there probably have fewer resources per person. If this is the case, then of course this is a huge concern for a benefit that is targeting precisely those communities, but it also suggests a certain, quite promising approach to tackle take-up, which is on the resource side of those departments. But maybe I'm wrong. And for Angus, sorry, I can't resist because you have the last bullet that you need basically celebrities or non-government people who are liked to promote the benefit. But does this not also work in the other direction? So for instance, when the term benefit street was coined in the UK, was there actually could one observe greater stigma? I mean, one could imagine that people sort of put off going to the benefit office if the dialogue goes in this direction.
Thanks a lot. So you can start. Yeah. Okay, thank you for these relevant remarks and questions. So I will, yeah. So the first one is about irregular situation. So and people that are in street. So we can talk also about regular situation and the way people, migrants that have no papers or something like this, because this is also a rule in order to obtain, for instance, the RSA. So one of the rules is to have a regular situation in terms of really a migrant. But the question for the answer for your question is that unfortunately we are not able to encounter this situation and these people, and there is no data on this. Let me say there are some surveys on people that are in street, but we cannot have information on take-up, on their situation, because here we are really focusing on the ERFS, which is a very rich data. But what we can find is really specific, like small surveys for non-ordinary households. So the answer is that unfortunately we cannot encounter these situations, but maybe we could we could think about it because we are thinking about it, and we know that this is a big limit. And as I have mentioned, it's very element in each country. I think they are also talking about this problem of not encountering these situations. The second question about the amount, so it's real that we could imagine that people that do not take up are people that are eligible for only small amounts, but what we have found is that non-take-uppers do not take up for even, on average, we have found that it is equivalent to what beneficiaries take up for. So it means that finally, the amount is not, and even when we have conducted the empirical model on the determinants of non-take-up, we have found also that the amount is not significant, and it means that finally this assumption is not checked. Just to talk about people that are not aware of that they are eligible to the benefits, I think this is a very relevant issue because one form of non-take-up is to do not know about the existence or about to be not aware of the eligibility, and there is much debate on fighting against non-take-up and also this form of non-take-up. But I think this is not realizable. This could not be realized now, but on the long run, in an ideal world, I will say, we could be able, like, to have an automatic benefit and to have just information on the situation of people, on their incomes, and to inform them that you are eligible. But I think this is not very evident to obtain. But there is a debate in France and perspectives in order to attend this, but not, I think, not on the short run. And the last question about the drivers of non-take-up in our empirical model. So when I have talked about quality of administration, so it's not easy to find proxy for the quality of administration, especially because we have worked on the beneficiaries of RSA in the RFS, and what we have done is to match data only at departmental level. So we have tried to obtain some indicators of the quality of the administration at departmental level. It's not a perfect level because it's much big, but we have succeeded to obtain some indicators of department in which, for instance, percentage of files that are treated in less than 10 years, departments in which we have much back and forth in the treatment. We have also matched with another survey of the Défenseur de droit, in which we have some indicators on at departmental level to ask people if they have some problems with the administration, especially with the CNAF, which is who pays for the benefit, and what is the type of problem? Is it due to non-communication? Is it due to like much back and forth? So what is the type? So we have tried to include these indicators in our model, and what we have found, as I said, is to find that what is significant is rather departments in which that treat rapidly applications. So there is less people that are living there are less likely to know take up, and also, as I said, people that departments in which there is much back and forth, that are more likely to not take up. So that's the way that we have. There are very like a proxy in order to reflect the quality of administration. Thank you.
Yeah, and just to briefly add, so on irregular situations, I think what we do is just think about not making it even harder for people in those groups. So make sure your design of your service is accessible, so it doesn't require an address, it doesn't require a bank account, and so on. So think about that individual when designing, but that doesn't mean you won't miss people with completely chaotic lives. Probably do. They probably come in and out of our system. I'm sure you're also right, if you only are entitled to a little bit, you may not bother claiming, or you might claim, realise it's only a little, and then stop. But I guess a partial solution is just to make the process really, really easy. On obstacles, your point, I wonder whether there's a language issue. So we, at least internally, we talk about low or no income, which I think is probably less of a hurdle than poverty, because that has certainly in the UK context, has a stronger sense. I think you think about the way you describe who it's for and what the conditions are. And then finally, on your point, I do worry about stigma still, and in fact we've got the creation of universal credit moves away from our old system of what we used to call tax credits, which were administered by the tax department, and I worry that the people in work were happy dealing with them because they understood them and they thought, yeah, they're for people like me, and that when we write to them and tell them we're stopping their credits and they need to claim universal credit instead, that there is I think a bit of a cultural hurdle to get over, but because we're brilliant, they'll come to love us, I'm sure. And then the final thing, I don't know how you go about creating one in Spain, but there's a man called Martin Lewis in the UK who runs a website called moneysavingexpert.co.uk, I think, or maybe .com. And he gives all sorts of tips about the best savings rates at banks and the best offers on toasters, but also the benefits to take up. And so he can be a thorn in our side when we're doing things badly, but he's a miracle when it comes to people actually realizing what they're entitled to and claiming it.
Thank you so much. Muchísimas gracias a todos.
Thank you so much to all, particularly to Angus and Cyrene. It was a true pleasure to learn from you and listen to your speeches. We're reaching the end of the session. Thank you.
So, wait, I'll wait a minute. Yes, okay. So let's now begin the last session of this very intense working day. After a very interesting session on non-take-up that I think has really highlighted a few things. For example, how the non-take-up process works, as Elena Costas explained to us. Also, to what extent this is a very extended phenomenon across many countries, but it's not always part of the public debate, as our speaker Serene was saying. And we have also had some hints of what can increase take-up, like, for example, in the case of the universal credit in the UK. And what we wanted to do with this last session, it was to really focus on one particular kind of policy interventions for incomplete take-up, which is active outreach to potential beneficiaries. For this, we are going to have two speakers. One of them will join us virtually later. And our first speaker, okay, so, yes, because I think we can use that one, yes. So I would like to give the floor as our first presenter to Mónica Martínez Bravo, who is Associate Professor at CENFI, and since 2021, she collaborates with the Spanish Ministry of Inclusion, Social Security and Migration in the evaluation of inclusion pathways as a scientific coordinator. She will be giving a presentation on active outreach in the context of the Ingreso Mínimo Vital. So, Mónica, the floor is yours. We are looking forward to your presentation.
Thank you very much for the invitation and for the inclusion in this very exciting workshop. So, I don't know if my slides are up there. Still not. Yeah, thank you. Does this work? Oh, okay. Great. So I'll be very brief because most of these things have been said in the previous presentations. But just to set some things very clear, typically we define non-take-up rates as the ratio between the number of recipients that are accessing a particular social benefit with respect to the number of eligible population, right? And as we know from the previous presentations and from many studies, this ratio is far from one, right? Not everyone that is entitled to a social benefit ends up having access to it. So there is a recent literature review by Coe and Moffitt that collect this kind of non-take-up rates from a number of different countries, and you can see here a number of them. There is wide variety on these non-take-up rates. We could think that to some extent there could be some measurement error, but even by taking that into account, we could think that still taking aside measurement error, non-take-up rates vary quite widely. And it's true that there seems to be an association suggesting that low take-up rates are particularly large when the system is designed in a way that there is a voluntary application process where the recipient needs to take a number of steps to access that policy. So I guess that, you know, in line with the previous presentation, it's important to keep in mind that regardless of whether these non-take-up rates are 10% or 90%, it's still a tragedy, right? So, you know, so the fact that even a small number of individuals that are entitled to a policy are not able to access it, particularly when we think about vulnerable populations, is a tragedy in and of itself, right? So I think, in my opinion, despite I love data and data analysis, we should probably perhaps not be obsessed in getting the ratio right, but focus all our attention or most of our efforts in trying on how to fix it, right? How to you know, improve the design so that it helps. And of course, how to improve it depends critically on what are the reasons that I generate that non-take-up rates, right? We've discussed here a number of them, but just to, again, be very clear, we could differentiate them, the potential reasons in terms of lack of information. People don't know about the policy, don't know that they're entitled to it. Low incentives to apply. It's true that some individuals for 10 extra euros per month might not go through the process of asking it. Big important part of it might be bureaucratic hassle and the difficulties in the processing of or accessing that help. And of course, there is a stigma, right? And perhaps that's definitely missing in the slide, right? So there are these 4 potential reasons that are kind of demand-driven, that are preventing the applicants from, taking a step forward and saying, I do want this or this assistance. And then the 5th one, in a sense, we could think of measurement error, but that's a separate kind of. That's a separate type of issue. And it's important also when we think of measurement error, it can go either way, right? You could either overestimate or underestimate the non-take-up because there are biases going in different directions. So I guess that, consistent with what I was saying, I think that we should focus our efforts in trying to think about how to reduce as much as we can non-take-up rates. So I'm going to tell you about, in just a minute, about an exciting project that we are launching in the Spanish context. And this is going to be in the context of addressing non-take-up rates of the minimum income scheme, the Ingreso Mínimo Vital, that was launched by the government by the Ministry of Social Inclusion in Spain in 2020. This is a very new policy, and it has been developing and addressing and introducing changes to address non-take-up and other difficulties in the policy. So that has been definitely a very good steps in the right direction. But still today we have a very large non-take-up rates, right? So the last estimates from IREF suggest that there is a 57% of the population that are entitled to the program that are not getting it, right? What are the potential reasons? The same apply in the context of Spain, in my opinion, as the ones that we described before, although this is perhaps something that we are still trying to figure out. So in that effort in trying to figure out, also by the initiative of the ministry, there was a survey targeted to people in situation of non-take-up, with some of my colleagues here had this leadership in pushing for the survey, and some of the lessons are very interesting, right? So it seems that 1 out of 4 people in situation of non-take-up were not aware that they might be entitled to it, right? So this suggests that lack of information is an important, or could be an important barrier in this setting. There could be also difficulties with the application, and you see anecdotal evidence here and there. Also the work by Elena, as she suggested in the previous presentation, suggests that there are difficulties in getting the right documents and so on, right? So a non-negligible percentage, about the 15% of people that were aware of the social benefit, say that they tried to apply, but they were not successful in fulfilling the application process. So this already suggests that there is some scope for fixing or improving in terms of ease of application. Something that is we perhaps have said not so much in the previous presentation is or in the literature on non-take-up, is the possibility that, from the point of view of the applicant, there might be uncertainty on whether the process is going to go well or not. And if I don't know if I'm going to get it or not, perhaps psychologically I don't want to put up with the psychological cost of feeling very disappointed after getting a rejection. And I think that this is perhaps important, and it would be great to think about how to identify this empirically. And some of the things that this report from IREF suggested gives us indication that perhaps this is plays a bigger role in Spain than we have thought about it. So first of all, on average, there is a 60-day delay in getting a response on whether you get the day. So when you are in an extreme need, 60 days is like eternity, right? And this has been declining as the social benefit has evolved, but it has not reduced much farther than 50, 60 days, right? So that's still the way that they have today. And furthermore, 70% of the applications are denied, right? Some of them for good reasons. The person didn't qualify, they had incomes above the threshold, but in other cases it was because there was some difficulties on the household composition, or kind of the records that the administration had didn't match with what the individuals had. So there are these things could lead to a lot of uncertainty from the point of view of the applicant, and that might discourage people from going through. Another thing that is also interesting from this study from IREF is that the non-take-up rate is not very different between when you look at the income level of people. So for people below 7,000 euros per year of income, you would expect that those that earn 1,000 or 2,000 will have a lower rates of non-take-up because they can be getting more. But it's not showing that in the data. After 7,000, there is a decline, but not below 7,000. Right? So that could be suggesting that if those that are poorer among the poor need the money the most, right, we might have some potential greater mistargeting among the poorest of the poor. So on that line, continuing on the idea that we should focus on how to fix things, the ministry is supporting an exciting project which is led by EAPN, European Anti-Poverty Network, by the Spanish branch of it. The key of the program is to pilot an intervention in which we're going to go on site to areas where the poor typically attend, such as food distribution centers, and we're going to do an information campaign and an assistance campaign to see if people are getting, first information, but also assistance in these very direct on-site activities. Before getting into the details of the program, let me also say a few more words about the implementing partner, which, as I said, is EAPN in Spain. This is being led by José Javier López, who is here with us, and Elder Ferreira. So you can get more details from them. They are doing the very hard work, and they are the ones really running the show on this. And then from the part of the ministry, with the help from SEMFI and also JPAL, we are providing assistance on the evaluation part, on trying to make sure that the implementation is properly evaluated, and this is actually being done in the context of randomized controlled trials, which I'll also describe in a second. And just a hint on this, this style of, or this idea of piloting an intervention, seeing how it works, and evaluating it through a randomized controlled trial is something that the ministry has been conducting in very different programs. Some of them you have seen it this morning. Some of them you're going to see in the poster sessions also tomorrow. But this is kind of a new approach of trying to test social interventions and see what works before some of them might be scaled up. So let me say a few more words about the intervention and why this is novel in the context of other things that have been tried to address non-take-up. So the key novelty is that we want to go directly where poor or vulnerable populations are and they regularly attend. So the idea would be to launch an intervention in 200 meeting points. This could be shelters, food distribution centers, NGOs, that typically they have this influx of people asking for help. The idea would be to, for a period of 3 months, going weekly to these areas and having a stand, a visible stand, where people can reach out for help and for raising questions. So this is going to be an information, but also the recurrent present might facilitate that people reach out, ask questions, and they're going to also be derived to more in-depth kind of social assistance in order to process the applications. So what can we learn and how this is different from what we learn in other settings? So potentially the closest study is by Filkestein and Noto Widigio, in which in the context of the US, they send letters to potential recipients of food stamps, informing them that they are eligible, potentially eligible for this assistance. So these sending letters and also following up with some of them for further assistance on the application was successful in reducing non-take-up, so that's great. But one surprising result is that it was not helpful for addressing non-take-up of the poorest individuals, right? So we have still this last mile issue in reaching out to the people that perhaps need the help the most, right? So potentially these on-site activities going right away where there is a greater pool of people in need might prove more effective among the poorest, and that's something that, of course, we'll need to evaluate empirically. So what is a randomized control trial and how it will play out here? So our partner organization, EAPN in Spain, will identify 400 potential locations. So 400 potential food distribution centers, shelters, and so on. And out of these 400, they will be randomly assigned to one of two groups, to the treatment group or to the control group. So in the treatment group, we're going to do the intervention that I described in the previous slide, but not in the control group, right? So the idea is that since these shelters or these locations would be in one or the other group just by chance, they are in a sense comparable ex ante. So if we see difference down the road, it has to be because of the treatment group you had this intervention. So this will allow us to estimate the causal effect of this program in non-take-up as well as in other socioeconomic outcomes that we care about population. So how are we going to measure the outcomes? Because here the treatment is going to be at a location level, right? At a coordinate in the space, if you wish. So first of all, we're going to, and EAPN-S is also leading this part, we're going to collect data through phone surveys. So idea is that before the intervention, there's going to be phone survey trying to get 30 respondents from each of these, close to each of these locations, and we're going to ask them questions about their understanding about the minimum income scheme, about their opinion, whether they know whether they're eligible or not, whether they applied, and so on and so forth. Then after this baseline survey will be conducted, we will randomize to treatment and control each of these 400 locations. And then after some weeks or months after the intervention, we will conduct an online survey recontacting the same people that participated in the baseline. So that's going to be able to tell us whether perceptions or beliefs about the minimum income scheme and accessibility have changed over time. But in the current setting, we actually can do even better than this detailed phone survey because we can complement this with administrative data. The ministry will have information on how many new applications are coming from the different areas, right? So for here in this map is a hypothetical map. There still hasn't been any identification of the points, but just for illustration, suppose that this is a map from a neighborhood in Barcelona, and suppose that we identify that the blue and the red dots as potential locations, and just by chance the blue one gets to the treatment, the red one's to the control, but in each of these circles we're going to trace kind of a catchment area, and we're going to be able to see how many applications to the minimum income scale emerge from people residing in these two areas, right? The richness of the administrative data is also going to be helpful in order to see whether we're getting these new applications from the poorest of the poor or the mildly poor or where within the distribution of the different neighborhoods. So this is one of the key advantages. So just to wrap up, the expected impacts from this study would be, first of all, to see whether this program is effective, because we're going to be able to estimate the causal effect of these on-site interventions on non-take-up and other outcomes. So ideally, we will be able to benchmark the effectiveness of doing this relative to other types of policies. We're going to be able to test whether there are heterogeneous effects, whether this program is more effective among the poor or among the not so poor within the people in situation of non-take-up. And we're also trying to think about creative ways also in uncovering the mechanisms, also with the use of the surveys, which we're going to be able to also dig deeper into the underlying reasons for not having applied for this position. So that's pretty much it. Thanks a lot, and if you have comments, please feel free to reach out to us.
Thanks a lot. Thank you very much, Monica. I think this is very interesting, and I'm really looking forward to seeing how the project moves forward. And now I think we have virtually joining us Ralph van Gestel, I hope I'm pronouncing it okay, who is Associate Professor at the Erasmus School of Health Policy and Management from the Erasmus School of Economics in Rotterdam. And he will be giving us a presentation also on active outreach on a paper on improving take-up by reaching out to potential beneficiaries based on a large-scale large-scale field experiment in Belgium. So Raf, thanks for joining us, and the floor is yours.
Thank you a lot for inviting me. Let me first try to share my slides. I hope that you see it well. Can you see my slides?
Yes, we see it right. You have around 15 minutes.
Okay, perfect.
Thanks.
Thank you. First, I'm very happy to be invited to this workshop, and I really regret not being there. So even though I'm not there, if you have questions afterwards or you want to reach out, feel free to send me an email or to have a chat with me, because I'm very happy to discuss this. So what I'm presenting today is joint work with some colleagues, and you can also read up on it in an article in the Journal of Social Policy. And it will be about evaluating an outreach program or an information campaign in Belgium for means-tested benefits. So I think that this first slide is sort of redundant in this audience, but let's just use it to set the stage. We know that social policies are in place to protect people from economic hardship, but when there's means-tested benefits, then non-take-up of these benefits may undermine the effectiveness of social policies. And we know, as the last presenter has shown, that there's high percentages of non-take-up of means-tested benefits, and that's where our study comes in. And we ask ourselves the question whether a simple mailing and a simple information campaign, which will consist of a letter and a flyer, whether that increases the take-up of a means-tested benefit. And that means-tested benefit is the increased reimbursement for healthcare costs in Belgium. That means that if you are below a certain income threshold, then you are allowed this status of increased reimbursement, and that will lead for you to have lower healthcare costs. Because it's really focused on Belgian healthcare, I want to just give you some background that's probably important to understand the setting and the intervention that's being implemented. So in Belgium, there's compulsory health insurance, meaning that everyone's obliged to have health insurance, and this health insurance, basic health insurance, is offered by 7 so-called sickness funds or health insurers. And that basic package is offered at the same price for by each health insurer. So there's basically no competition between health insurers to get clients into this basic insurance package. What we see in Belgium is that there's a large percent of healthcare expenditures that's financed by individuals and households. Definitely, if we compare it to neighboring countries, the Netherlands, Germany, and France, we see that nearly 18% of healthcare expenditures are financed by individuals and households. And the fear, therefore, is that if a high percentage is financed by households, that, of course, the low-income households will not take up the care that they would need. And that's why there's this system of increased reimbursement, and it's considered the main safety net in healthcare. Some groups in the population receive the status of increased reimbursement automatically, for example, social assistance beneficiaries, but there's also a means-tested part of it. So if you fall below a certain income threshold, you are also eligible for increased reimbursement. And that depends then on an income test taken at a local health insurance office. Of course, because this is means tested, there's believed to be quite some non-take-up of the increased reimbursement. And that's where intervention will come in. So this increased reimbursement, what is it? I've also already referred to it. You will pay less for healthcare, but that's through different channels. You will first face reduced co-payments, so a reduced share that is paid by the individuals or households, a third-party payer system. I'll get back to that in a couple seconds. A lower deductible under out-of-pocket maximum. That means that if you reach a certain threshold of, for this population, 450 euros of out-of-pocket expenditures for healthcare, after that amount, you will not have to pay anything anymore for your healthcare expenditures. And this threshold of 450 euros is lower than for other individuals in the population. Because health insurers have quite administrative capacity, there's also some other financial advantages coupled to it. So the health insurance offices are very well at identifying low-income individuals. So that's why this is also used to provide public transport discounts and several other benefits for individuals. Let's think about if you go to a family doctor, to your own general practitioner. If you would go there in a regular setting, you don't have any status of increased reimbursement. What would happen is I would pay 26 euros on the spot to my doctor, and I would get 22 euros back from my health insurer afterwards. So that makes that I would pay 4 euros for a visit to my family doctor. If you fall under the increased reimbursement, then on the spot, you pay less than this 4 euros. You only pay 1 euro, and you don't have to pay anything. You don't have to pay the 26 euros on the spot. You only have to pay the 1 euro. And that's a third-party payer regulation. So you only have to pay the 1 euro on the spot instead of the 26 euros. We see that this increased reimbursement matters a lot because if we calculate it on average, the individual part of healthcare expenditures reduces to 6% instead of 16% without increased reimbursement. Okay, so there's quite some benefits from this increased reimbursement. We think that it would help a lot for low-income individuals to not forego care that they would need. And there's a lot of non-take-up of the increased reimbursement. And then there was a royal decree, so by law, it was enforced in 2014 that all health insurers had to contact their members that were potentially eligible for the increased reimbursement. How did that go? There was a check with the tax register data, but that's dated data. So that's data from income of 2 years ago. A check which identifies low-income households, and to these low-income households, all the health insurers had to send had to contact these households to take up the increased reimbursement. We worked together with the largest Belgian health insurer, that's the Christian Mutuality, and it covers nearly 60% of the Belgian population. And for this health insurer, nearly 200,000 households had to be contacted. Of course, what happened? The health insurer didn't want to contact them all at the same time because it would create quite administrative burden, because if only 10% of these households would come to the local health insurance offices, 20,000 individuals would come there within the next months, which would be too much of a burden. So that's why they decided to contact these 200,000 households at different times. What we then did is we randomly allocated the households to be contacted to the timing of the contacts, meaning that the characteristics of the individuals contacted in the first instance are exactly the same as those contacted at the later instances. We contacted them through a letter and a flyer, and given that their characteristics are the same, what we can do after the first households received the letter, but the later households didn't receive it yet, we are going to look at the effect of the letter on the take-up of this means tested benefit of the increased reimbursement. So then we can see what is the impact of the letter and flyer on the take-up. Of course, this letter and flyer are quite rudimentary, but we believe it decreases complexity and it improves the understanding of the benefits of the increased reimbursement. So what are the questions we ask ourselves? What's the effect of the mailing on the take-up of the increased reimbursement in general? And then some subsequent questions. Does this effect last long in time? Who benefits most from the mailing? And are there important regional patterns? These regional patterns are not present in the paper anymore, but I think that they're important to think about what is relevant in developing outreach campaigns and information campaigns to reduce non-take-up. Okay, so for this large health insurer, they have 19 regional funds, and 10 of them participate in the experiment. Why do 9 not participate? It's because they want to contact their members earlier. They do not want to have them randomly allocated to different timings. They want to contact them as soon as possible. So that's the reason why they dropped out. And the treatment is not exactly the same for everyone. So 1 in 6 households also first receive an email with the exact same content as the letter. And some regional funds, out of these 10 regional funds, may carry out additional phone calls. So in addition to the letter and the flyer, they always receive the letter and the flyer, but they also receive a phone call. But I'll get back to that in a minute. And that might further reduce information costs, process costs, because they get an immediate appointment, and it may further reduce stigma. There is some language issues because the letters were sent in French and Dutch and German, but a considerable part of the population might not speak any of those languages. Just to show you what I'm talking about, this is a sample letter where it's very formal, very short, very dry, so to say. Dear Mr. or Mrs. X, according to the information of the Federal Public Service Finance, you might be entitled to a higher reimbursement for your medical expenses. I would say that this is not a very appealing first line, so you might take that into account in developing such kind of campaigns. But I'll get further back into it a bit later on. This very formal letter was complemented with a flyer. And here you see that you receive some more benefits, information on the benefits. So what are the benefits? How can you make an appointment? And you see also which documents do you need to bring. And then you see that the list is quite extensive, so that might hinder a lot of people to apply for the process. So that's the treatment that we're using. We're sending everyone this information, and then we're going to see how it looks like. Here we only contact household heads born before 1985 because they're not very young, and for the very young, we would suspect that the income status changes considerably over a number of years, and that's why we didn't think.
Raf, just as a reminder, we have more or less 5 minutes left for the presentation.
Yeah,
okay?
I'm gonna make it.
Thanks.
So everyone on a similar address, we're going to contact at the same time, so that there's no spillovers between or no contamination of the treatments. And here you see in the table 6 waves, so 6 different timings, and we're going to look after the 3rd wave, what happens to the take-up of these first 3 waves, and we compare them to the later 3 waves that were not informed yet. We want to know that the characteristics in these different waves of the people in the different waves are exactly the same. And this is just to show you that it is true that we can say that the people who were contacted first are the same as the people who were contacted last. For the sake of time, I'll not talk about this too much. Here you see the different waves from 1 to 6, and then the number of applications and the approvals. And in the first wave, you see that there's approximately 30% of the people that were contacted that applied and 20% that were approved the increased reimbursement status. The 4th wave until the 6th, the control groups, so to say, so those who did not get a letter, they have a 5% approval and also 6 or 7% application rate. So what we see is that there is an effect of 15 percentage points in take-up rate of the increased reimbursement. So that's quite a large effect just from a letter and a flyer, which are not very appealing, I would say. If you look at the timing of the effect, you see the number of days and the number of people according to the number of days after they received the letter. And we see that most of the people react within, let's say, 50 days. So if you are considering contacting people in different waves to reduce the administrative burden, then I would say you would want to contact everyone within a reasonable amount of time. So 2 months apart seems to be quite an appealing number of months between contacting people. We also see that there's sort of a persistent effect over time. So if you look at the right figure, the proportion of applications and approvals remains higher in the groups that were contacted compared to the groups that were not contacted. If we look at who benefits from the mailing, the people that we reach with the mailing are in general slightly older and have higher healthcare expenditures than those who do not respond to the mailing. So that seems to suggest that the intervention seems to reach the most vulnerable, apart from those who always, apart from those who would always respond to the mailing. Nearly the last slide is that here you see regional variation. So these are the different approval rates for the increased reimbursement according to the different regions. And here you see a lot of differences. And those are the regions that had additional phone calls on top of the letters. And there you see that some of the most performing regions, they had phone calls. But then in region 9, I can't use my mouse to look at it, I think. So in region 9, you see a very small effect. And this was because of the design of the phone calls. The first line that people said on the phone was, we got your information from the tax administration office, and we think that you might be eligible. So the design of these phone calls and of these letters seemed to make a lot of difference in the effectiveness of the outreach. Just to wrap up, it seems that even simple reminders like a letter and a flyer can have a substantial effect on the take-up of social benefits in low-income groups. We see long-lasting effects on improved take-up, and most of the responses happen in the first 2 months, which can matter for the design of the intervention. Also, the ones that we reach are the most vulnerable. At least they're more vulnerable than the people who do not respond to the mailing. And it seems that there's strong differences across regions and across group characteristics, and that might partially be driven by the intervention, so by the phone calls, by the types of letters that they receive. Okay, I think I rushed a bit through it, but I think that was it. So I'm happy to take any questions if there are any. Thank you a lot.
Thank you very much. So we still have more or less like 5 minutes for questions. I don't know if there's someone in the audience. Yes, so I see Angus raising his hand. Can we get him a microphone?
Probably both of you. I'm just interested whether you had any difficulty persuading politicians that randomized control trials are good, because we believe they're good. But occasionally the idea that you have a treatment which you think might be successful, but you're not going to give it to some people, does not go down well. And then a sort of related question for the Dutch colleague, that the idea of sending a letter that says you might be eligible, was there any worry either in the ministry or at political level that people receiving it who aren't then get more cross with the government?
Sure, so let me say that in this case, actually, it's the government who convinced us to help them into doing the RCT. So I think that the Spanish case is very special and very unique in the sense that within the law that gave support for the minimum income scheme, within that law there was also a big initiative to spend 300 million euros from the European Reconstruction Fund to pilot all these activities, and they committed to do this through methodologies of randomized controlled trials. So this is all that Milagros Paniagua and the Minister José Luis Escrivá launched with the support of the ministry. So in a sense, from academia, we're just trying to give them support into doing this as well as they can with our expertise on RCT and also suggesting ideas and so on. But I think that it's a very unique and special moment. It's very peculiar in the context of Europe, but we're trying to to advocate for this as a very useful tool in order to learn what works and what doesn't, in the sense of instead of pushing for a policy and evaluating ex post, it's very innovative in saying, okay, let's first pilot, see what works, and then we can scale it up. So I wish we have another hour to talk about this, but perhaps you can learn more about all this initiative tomorrow. Yeah.
Raf, if you want to go ahead.
Yes, just to add to it, I think I was also slightly surprised about the Spanish case, because also not everyone gets treated in the end. So I think that's the benefit of the setting that we had, that everyone gets the mail in the end, just that some get it slightly slower than others. But that was then from administrative consideration. So that's, I think, all incentives aligned. We just wanted to evaluate, and there was already a very good way of evaluating it and having the randomized setting within the framework in which the intervention or the outreach was implemented. So that was very lucky for us. As far as I know, there was no big deal was made out of contacting people that might not be eligible. I perfectly understand your question and your concern, but I think that there's two things that you weigh here. It's first, the low take-up rate and and the people receiving the letter who might not need it receiving it, but then probably the problem of non-take-up was just considered too high or much higher than the other problem.
Okay, thank you very much. So we are keeping it quite on time for the afternoon, which I think is good given the probably 30 degrees that we are at the moment in this room. So with this, I think we can close this session. Thanks a lot, Monica. Thank you, Ralph, for these very interesting presentations and also for the discussion. I'm looking forward to seeing the results of the Spanish experiment, and maybe to see also how cases similar to the Belgian one can move forward in improving take-up rates. So thanks a lot, and we will start moving towards the more closing part of the conference.
So, since we don't have coffee anyway, then before it gets too loud, maybe I just kick off the last part of this day. And my role is to wrap up. And just ask my chair, is it okay if I do? I think I'm supposed to wrap up two things. Can I do it in one go?
I'm afraid not.
Okay.
So let's. Actually, you're going to be the last one to wrap up. The last wrap up. So
okay, I will hold back. I mean, one can wrap up in two different ways. One is, especially after a long day or long sessions, one is to say something completely different about the outlook. And the other one is trying to remember at least the essence of what was said and work with that. So the first is easier but less exciting. The second one is a bit riskier. So I will try to focus on the substance. And I think there was actually a lot of it in our take-up sessions. And in particular, I think we made the bridge from the technical to people's experience. So that people-centered perspective that we spoke about in the morning. And I think debates around take-up do not necessarily always succeed in doing this, and focusing on what matters most to those concerned. So I think this was very nice and I think an achievement. I think one message that was framed, formulated very nicely is the need to do careful measurement, but to not be obsessed about it, about the details of it, or the very precise results, and also the need to go beyond measurement. So what drives benefit take-up? I think one question that maybe is something to reflect on more also in our project and in the report that we write is non-take-up necessarily always unintended, by everyone involved. So often, I think when one reads about take-up, it can be framed as a sort of a moral issue. That it's necessarily a bad thing. I think there are definitely concerns about it, but I think the sort of moral perspective is not necessarily always useful if one wants to engage policymakers in the debate. So, for instance, is non-take-up actually a way of prioritizing limited resources or conditioning on real need? And that, I think, was illustrated by Angus's example of the jump in universal credit in March 2020, when there was a much bigger need and more people took up the benefit. So that suggests that there's something behind that. Second, there are, of course, requirements that are very difficult to simulate, even if one has very fancy simulation models. So, for instance, activation requirements and things you need to do that cannot really be observed, to look for jobs, to turn up at the benefit office and so on, and otherwise there may be sanctions. Sure, sanctions may be more relevant for some for benefits that are not minimum income benefits, but nevertheless this can have important signaling and may also affect whether people apply in the first place, just because they fear that there might be a sanction. And there can also be other discretionary decisions left to the benefit agency person, and all these factors, they can be behind non-take-up, and they can be significant concerns. But I think there's a need to be pragmatic and sort of hard-headed in the study about non-take-up. Angus said it is quite possible to be on one benefit but not the other. That's a very important point, because I think it hints towards the usefulness of using existing receipt of some program as a way to reach out about possible entitlements to other things. So there can be straight passporting, where if you get one thing, you automatically get the other. And that's a good thing, but that doesn't always work, because there's not a one-to-one link between different support programs. And I think what we heard is that one can also work with probabilities. So, for instance, in some countries it may be quite likely that somebody with unemployment benefits and, let's say, several children would also be eligible to social assistance top-ups, and that can be accounted for in sort of the outreach strategy. Maybe there can be some sort of automatic communication. Or somebody moving off longer-term out-of-work benefits back into work may be quite likely to qualify for in-work support, because their wages may be quite low, and that's also relevant wherever in-work benefits exist, but also relevant to the debate in Spain right now. I think an interesting example was given of the special take-up surveys, in the sense that one can learn a lot from them even if they can't be done regularly because they are expensive, but perhaps they can be a very good approach for a new program, because you don't necessarily have to do it regularly, but a one-off push or investment can be valuable just to get that initial design right and to try and fill those take-up gaps from the very beginning. I think another interesting example was to use data to target the non-takers. We've heard about this with reference to the Netherlands. And something that I just thought about a little bit during the discussion of the need to promote or disseminate the existence of a benefit, because some people may not know about them, or they may not understand that this benefit is for them because they sort of have a different perception of their situation than the administration or the government may have. Perhaps labeling can be key here. So, for instance, instead of calling program social assistance, why not call it if you have less than 400 euros benefit? And that's quite clear and could maybe deal with that. And I think more generally, but the last point fits into this. I think Ralph said simple solutions can work, so that's a nice sort of hopeful message. One doesn't have to necessarily go very complex in addressing non-take-up. And I'll stop here. Thank you.
Thank you, Herwig. So, Milagros, if you join us, then we can start with the official and formal closing of the conference. So, well, thanks, Herwig, for this wrap-up on the non-take-up sessions that I think have been really interesting and also very valuable for our project and for the gathering of best practices. And now, to formally close this session, I would like to invite the Spanish Ministry, the European Commission, and the OECD to give their closing remarks. So first of all, I would like to invite Milagros Paniagua, General Secretary for Inclusion, to give her views on this day of intense conference that we had. The floor is yours.
Okay, thank you very much. I'd like to start saying thank you to all the speakers, to all the participants, because I know it's been a very fruitful meeting and conference. It's difficult to do a good wrap-up when the first one has been so good. So I'm going to be very quick in wrapping up, but how can I provide a good wrapping up? So I try to give you the perspective of a policymaker, which is what I'm doing now as responsible for this policy. Okay, so I'll try to follow the things that have been presented in the session of non-take-up, and then I'll go to the first session to cover the integration part. So going to the non-take-up, several issues have been presented. First of all, it's been the phenomenon. Then the ways of measuring the non-take-up. Also the drivers, the determinants of the non-take-up. And finally, there's something very important from our point of view, which is the actions taken, because we are responsible to reduce that non-take-up. Going to the phenomenon, we did know the phenomenon by the time we were designing the non-take-up. So we knew that the non-take-up was going to show up by the time the minimum income scheme was being deployed. Now, ways of measuring the non-take-up. And I'll let you know how we performed the estimations at the beginning. We had access to the best data available, having information about the potential beneficiaries, the eligibles. How did we do that? We accessed the register mixing census data and register data with information on income and wealth. So I'll give you the figures for Spain. Spain has 18.5 households, around 45 million people. So we had information about income and wealth and their situation on the census side. And we performed the estimation, having the law. I mean, we've been talking about non-take up, but the difference between how the law is written and if we should cover more, I'm going to start just using the eligibles, knowing the law, okay? So we had our figures, and the thing is that we could tick where the eligibles were. Now, this was provided before the minimum income scheme was run. But then the minimum income scheme was running, and we could cross the data from register, the observed data, to the potential data. And the problem came with the errors presented, the beta errors and the alpha errors. The beta errors, the alpha errors, sorry, we wanted to check why people potentially eligible didn't apply for the minimum income scheme. And there he comes, the first action. We perform an interview with some of the potentials to understand why they didn't apply, and at the same time help them apply for the minimum income scheme. This has been said before. We knew that the ones with a lower income were more likely to show up rather than the ones closer to the guaranteed income. And we went to look for them. And we performed a pilot with the tax authorities to look for these people. So they were sent an SMS to say if they wanted to join a survey, and at the same time if they wanted to be helped by the ministry. And we found out some things that have been presented today here. And 1 out of 4 didn't know the existence at all of the minimum income scheme. And the rest, 3 out of 4, still had doubts about the minimum income scheme. So as a result of that pilot, there's another second action, the minimum income scheme bus. That's something I talked to you about this morning, and it's something that has been running for a bit more than a week. The results so far are very good. We are finding out same issues as we found out when performing the pilot of the SMS. And we are helping people to come. We are informing them, and some of them have applied for the minimum income scheme. But more actions have been taken. Monica Martinez has been speaking and presenting us before one of the projects with EAPN, and that's another action which it's a bit different in the sense that this is one of the pilots out of the 34 projects we're running, the policy lab we have. And within this project, we will be using RCTs, as Monica has presented, and we will find whether informing these people, helping these people, counseling these people will reduce this non-take-up. The answer could be yes. I mean, I'm expecting to as a positive result, but the good thing of measuring using these methodologies is to what extent this reduction is going to be achieved. So we will be able to measure how much we will be able to reduce this non-take-up or the increase the take-up ratio, the participation. About the more actions taken, the campaign, because someone in the audience said something before about the people don't know, and the campaign goes in a way for through the bus to those vulnerable we want to help, but at the same time we want everyone to know about the minimum income scheme, and there's a whole campaign for the whole population. So that's my, this is what I can tell you in terms of policy making. You design the benefit knowing that the phenomenon is going to show up as soon as you start running the benefit, but as soon as it starts to appear, you start putting into action different things so that they help you to understand why, and you redesign things so that you can help those you were meant to help at the beginning. With respect to integration that has been presented this morning, we are so much interested in understanding this part of the inclusion policy. This morning, I told you how we thought at the beginning of designing this minimum income scheme, this inclusion policy is a twofold. On the one hand, we wanted to cover low incomes, and at the same time, we wanted to help people in this transition. So for us, knowing the best practices about transition is crucial. Tomorrow, we'll have a session in the morning where we will be presenting some experiences that we're running in Spain with this policy lab. Unfortunately, I know that some of you won't stay. I have to say thank you for your presence here in Spain. It's been a pleasure having you face to face. We were all looking forward to seeing each other again, not through the videos. Hopefully we will see you soon. Safe journey back, and look forward to having you tomorrow, to the ones that stay, and say thank you to the mini group who will stay tomorrow as well. And that's it. Thank you. Thank you very much.
Thank you very much, Secretary General, for these very important reflections. Now we will have the closing from the side of the European Commission, and for this we have Elisa Gomez Aleman joining us online. She is also one of the persons who has been more involved in this project that we are working on today ever since the beginning. So Elisa, the floor is yours, and we are looking forward to see your reflections.
Good afternoon, everybody. Can you hear me well? Yeah. Well, first of all, my apologies for not being able to join physically in Madrid. I feel I've been traveling to Madrid quite often these past couple of weeks, and sometimes you're faced with hard choices as to which events you can attend physically. But regardless, it's been a pleasure to follow the discussions remotely. It's also very challenging for me to wrap up after such comprehensive, let's say, remarks that have been delivered already. I will, however, try my best to sort of summarize the key takeaways, at least in my mind. I think number one for me, and this is an idea that has been kind of reiterated throughout the discussion today, is the potential for trialing and building the existing evidence-based through micro initiatives or smaller scale initiatives that can be developed upon at a later stage. I think the Spanish case the Spanish administration has very strongly promoted this way of working for quite some years in the context of the so-called social inclusion network, where the central administration worked alongside a number of regions to promote the integration of social services and employment services. But now, obviously, in the context of the Recovery and Resilience Plan for Spain and the pilot projects that have been, that the ministry and the regions have been working on regarding inclusion itineraries for minimum income recipients. So this shows a lot of promise, and it's definitely a practice that we salute and we encourage. At the European level. Also, this idea of incorporating the evaluation design already in the legal framework, or ex ante, let's say, think about how this practice might be evaluated at a later stage, and make sure that this is a practice that can be evaluated already when you design the policies. So this is something that we really welcome and salute. Secondly, this idea that, particularly in the initial stages, whenever you are trialing a new policy or a new way of working, there is this need for additional support and resources. I think we saw this very clearly in the morning sessions, coming from representatives from Navarra and the Lombardy region in Italy. This idea that to make up for existing disparities in terms of staff ratios, the size of catchment areas, the caseload, etc., you need to be able to provide additional resources to begin with and to promote this transition. I think this was another key lesson. There was also this message on, when during the session focusing on common working tools, the need to ensure that these tools are actually functional. It might appear self-evident, but we saw this very clearly again in the Italian case. Despite the high take-up rate of their new tool, they have seen that this is not used in a similar way by all municipalities, or that it seems to be used more intensely during the triage phase and not so much during the service provision phase. So these are all aspects that need to be carefully looked at and to make sure that these are tools that are useful for practitioners who are operating in the front lines, let's say, and who are actually going to use them in practice. There also seems to be a clear value behind multiplying the entry points and the sources of information for potential benefit recipients. And this is something that I think was very apparent in the English case. The idea that you might step into a primary care center to receive services in the area of mental health, and you are all of a sudden contacted by a job coach or somebody who could counsel you back to the labor market or provide guided support in other areas. I think this is a clear added value. Also, this idea that integration at the administrative level, so whenever you invest in a cross-departmental structure, that this might actually trickle down and lead to integration at the professional level. I think that was also something that stuck with me. In any case, there was also this message, I think, of when you look at integration. Perhaps, going for full integration in some cases might be a pipe dream, or not necessarily something that is desirable, given the disparities in team composition, sector-specific characteristics, etc. And so perhaps sometimes it's useful to think about it in terms of cooperation and establishing clear cooperation protocols and standards. And in this sense, I think simplifying procedures is key. This again became very apparent later on in the afternoon session, when the colleague from Angus was describing how universal credit operates in the UK. This idea that individuals might be expected to describe their particular circumstances, but it would be unrealistic for the administration for them to be aware of the entire service catalogue. And so, we have to make sure that we address burdensome application procedures and make them as user-friendly as possible. I think that was something that was a very strong message throughout, particularly when the information is already available in some shape or form at the central level. This idea that we're duplicating processes and asking individuals to compute information that the administration already possesses and is perhaps not interoperable, etc. These are key barriers that we have to address. When it comes to outreach, I echo some of the messages that have already been said, and I think the presentation by the colleague from Rotterdam was already, showcased this perfectly, this idea that sometimes low-cost interventions work, and it was very interesting to hear the representative now, Milares, from the Ministry of Inclusion, Social Security and Migrations here about this ongoing initiative to promote the minimum income scheme at street level via these mobile teams. If I understand correctly, this bus that is circulating or that is expected to circulate throughout the territory. I think this is a very innovative approach, or something that stands to bring added value. To conclude, I think overall, in the Spanish context more specifically, I think it's very clear that there is a wealth of existing initiatives at regional level. Oftentimes, decentralization is portrayed as as a barrier. I think in the Spanish case, there is a very clear argument or something very clear that can be said, is that the decentralized provision of services has led to a wealth of initiatives that could be further tapped into and explored in order to extract best practices and ensure a real, let's say, culture of learning and knowledge dissemination. This is something that the ministry, we see that they have been investing very clearly in this for many years. We are very proud to be supporting this project now, and to be, even if somewhat indirectly, but contributing to the fulfillment of milestones in the Spanish Recovery and Resilience Plan. through this, expanding the evidence base nationally and internationally, and contributing to what will become, let's say, the new new inclusion models and the new itineraries for minimum income recipients. At national level and also at regional level. So yeah, this is in a nutshell what I wanted to say. Again, reiterate my thanks to the ministry with whom we work very closely across a number of different projects, and also the OECD counterparts with whom obviously we have a very long track record of working together, and with whom we work very closely also in the context of this project. So thank you very much once again. I will leave it at that because I'm aware that you probably want to enjoy the city of Madrid. I really envy you. I would wish to be there with you now, but unfortunately, well, it'll be next time.
Okay. So thank you very much. Muchas gracias, Elisa. Herwig, the floor is yours for the final wrap-up.
It's the final one. It's the final, and then comes the enjoyment. It's the final one. So you've already heard enough or too much from me. So I will just make one substantive point and then mention some more practical ones. The one substantive point I think relates to the whole package of policy levels we spoke about. A lot in the morning was about integration or coordination, and naturally that focused on a range of different services, because that's what's most tricky in a sense, and where the fragmentation across institutions plays a role, etc. But the point I would like to make is, don't forget about the cash transfers. Just the fact that the cash transfer is set at a certain level doesn't necessarily mean that sort of it's dealt with and that no adjustments are needed. Of course, in addition to the critical role in providing income support, the cash transfer represents a vehicle for reaching people with the very services that we want them to take up. That's very obvious in the case of non-take-up that we have spoken about, but it is also relevant in the context of the cost of living crisis, where when the cost of necessities go up and people have to cut back on them, if the benefit is not adjusted in a targeted way, in a timely way, it means that people do not only miss out on the income support that they may have had several months ago in a similar situation, but they would also miss out on the support services that are connected to those benefits. So I think this is definitely the way it looks right now, an issue that will stay with us, and I think that maybe moves cash transfers back up the policy agenda, and that's good to keep in mind. On practicalities, just would like to mention that we know that we have demanded a lot from many of you, from the speakers from individual countries and regions, but also from the autonomous communities as part of the project where we collected information, conducted interviews, etc. This is not a one-way street. So as far as we can, we really would like to share, and we'll keep sharing the results of this project. We have your email addresses now, so beware, and we can share with this event, but hopefully beyond that, the results that come out, and also seek your comments. And likewise, if you have comments that you think of after the event, please don't hesitate to get in touch with us. And the second practical remark is that I think these discussions today really showed us that there's such a wealth of information, not only from individual countries and regions, but also actually from different DG reform activities that may be conducted in a very, for good reasons, in an encapsulated kind of way. But it's actually quite useful to have a thematic event such as this in order to exchange experiences and what has been learned from them in different places. And tomorrow, of course, there's the Minet event, and there will be even more wealth of knowledge there. So keeping this in mind, I think it is good to have these thematic meetings, and perhaps also a very good model that we, including at the OECD and the EU, can keep in mind also for the future. I certainly think so. Thank you very much.
So thanks a lot, everyone. Thanks for the attention all throughout the day. And we will see you tomorrow here at 9:30 a.m. Enjoy the evening in Madrid.